Good afternoon, everyone. I call the Committee of Supply Section A to order. We're meeting today to continue the consideration of the estimates of the Ministry of Health. I now recognize the Minister to move the vote.
Thank you very much, Honourable Chair. It's good to see you again today. Good to see everyone here. Good to see my colleagues on Zoom as well. I'd like to move vote number... I like that. Look at that. Look at that. I'm telling you. I was suggesting to the opposition health critic that at some point in the afternoon, maybe in the 5-minute break at 5:30 or something, they could try the wave on Zoom. We'll see how that works. Because that takes real skill. That would show professionalism. I'm going to move vote number 32, resolved that a sum not exceeding $23,725,698,000 be granted to Her Majesty to defray the expenses of the Ministry of Health, Ministry Operations to 31st March 2022.
And recognizing the Minister.
Thank you very much. Well, Speaker, there were a few detailed questions that were asked yesterday that we sought answers for, and I've got answers for to start our estimates debate today. The first was a question from the member for Kelowna Mission, who wanted some information on the net new positions added to the BC Emergency Health Services. In 2020-2021, there were 283 net new positions added. Those positions break down as follows: advanced care paramedics, 15, critical care paramedics, 6, primary care paramedics, 252, dispatch, 10. For 2021-22, nearly 400 net new additional permanent positions will be posted July 2021. The vast majority of these positions are primary care paramedics, as they are the largest component of our provincial service. The vast majority of the 400 new positions being posted in July 2022 are PCPs, CPs, but the licensing breakdown would be confirmed upon hire. CPs hold a PCP license. As well, there will be 12 additional dispatch FTEs added. The member for Cariboo North had some specific questions about the Quesnel station, again, of the BC Emergency Health Service, of the ambulance service. I just want to note that there are 2 ambulances still serving Quesnel. Today, one is full-time 24/7 and one is on-call 24/7. Previously, one ambulance was staffed with 1 full-time paramedic and 1 on-call paramedic, both posted in the station for their shift. The change that occurred converted the on-call paramedic to a full-time FTE. This resulted in 4 new full-time FTEs in Quesnel. The second ambulance in Quesnel was on an on-call ambulance for the area. There's no change in that. The member for West Vancouver Sea to Sky, who has some experience in this area, has personal experience in this area, asked a question specifically about Station 219 of the BC Emergency Health Services and other questions related to employees in his constituency. Pemberton, which is the station that he asked most specifically about, is part of the move to a scheduled on-call staffing model to stabilize staffing in rural and remote BC. Pemberton is moving to what is called pre-hospital schedule on-call staffing model. As part of the move, Pemberton will have 2 net new 0.75 FTE paramedic positions. These paramedics will work 3 days on, 3 days off, 8 hours a day, followed by 16 hours on call in their home or community. These are regularly scheduled jobs with benefits. Pemberton also has 2.53 FTE community paramedics. These positions are remaining and will continue to provide service to patients in their community, so a significant increase in service in Pemberton. In Squamish, Honourable Chair, there are currently 4 full-time paramedic positions in Squamish. With the conversion of casual on-call shifts, known as FOX shifts, which the member referred to, BC Emergency Health Services is adding 4 net new paramedic positions in Squamish, doubling the full-time staffing, and the area will continue to have the same on-call or kilo staffing it had had previously. With respect to Whistler, Honourable Chair, there are currently 4 full-time paramedic positions, and the conversion of casual on-call FOX shifts will result in 4 net new paramedic positions for a total of 8 full-time paramedics, so 4 to 8. The area will continue to have the same on-call kilo staffing coverage it has had previously. As part of the deployment of surge resources, there are also 2 acute care paramedics based in Whistler 7 days a week, Honourable Speaker. Further, there are 2 additional ambulances in the area based in Squamish and Pemberton, which are part of the 55 additional ambulances that were part of our surge response. All are 7-day-a-week coverage. The member for Nechako Lakes had a similar question about ambulance services in Grand Isle and the Grand Isle, called the Grand Isle Pilot Project. And just to be clear about his question, he asked about how that pilot project was advancing, whether the community of Grand Isle can expect to be part of that. As part of the province-wide transition to scheduled on-call staffing model for many rural and remote communities, and following the pilot prototype first rolled out on Vancouver Island, the village of Grand Isle is moving to a scheduled on-call staffing model being used in our smallest of communities. This will result in an improvement to their staffing by providing 1 part-time, regularly scheduled paramedic position to the station, in addition to the current 0.67 FTE current community paramedic, with community 911 response supported as needed by on-call staffing. The member for Prince George Mackenzie had questions about STARS and the relationship between BC Emergency Health Services and the STARS system. BC Emergency Health Services does use STARS when needed. In 2020, 2021, STARS flew 34 missions in the northeast and southeast of British Columbia. The BC Emergency Health Services Air Ambulance Program responds to emergency 911 medical calls and provides specialized emergency patient care and transport for critically ill and injured trauma patients across the province through the BCEHS Critical Care Transport Program. In 2020-21, BCEHS completed 7,453 transports. Of those, 2,291 used helicopters. A component of this program, of the CCT program, Auto Launch is a protocol that ensures patients with life-threatening injuries are transported to a trauma center as quickly as possible. The protocol simultaneously dispatches both a ground ambulance and a helicopter based on information provided by a 911 caller. It is available within the flight ranges of dedicated helicopters located in Vancouver and Kamloops that have a range of approximately 300 nautical miles. For areas not accessible for auto launch, BCEHS has early fixed-wing launch for improving transfer time for patients. The EFWL program also provides a second air resource for areas covered by auto launch where a helicopter is unavailable. The BCEHS dedicated air ambulance fleet consists of 6 helicopters based in Vancouver, Kamloops, Prince Rupert, Prince George, and Nanaimo, and 10 fixed-wing aircraft based in Vancouver, Kelowna, Fort St. John, and Prince George. This includes the recently added 5 additional air resources to improve access for patients in rural and remote BC. In addition to their own dedicated air resources, BCEHS can call upon 35 pre-qualified air carriers across the province to provide service as needed. As part of the Rural and Remote and Indigenous COVID-19 Response Framework, announced on April 20th, 2020, BCEHS has added an additional 55 ambulance and 5 new air resources to best support individuals in rural BC, including the dedicated air ambulances mentioned previously. The member for Prince George Mackenzie also asked about how many additional helicopters BC Ambulance has in their service. I think I just answered that, but just to be specific, have in service in the last couple of years and where they are. BCEHS has expanded air coverage by 1/3 as a result of additional 5 air resources as part of the COVID surge, moving from 11 dedicated air resources to 16. These additional resources are 2 helicopters located in Nanaimo and Prince George, and 3 fixed wing in Kelowna, and 2 in Prince George. The second Prince George fixed wing recently provided critical care paramedic care at nights. This is the first time 24/7 critical care coverage has been provided outside of Vancouver, which is obviously excellent news. There are 35 additional ad hoc service providers as well across the province that can be activated as needed. The 35 ad hocs, Honourable Chair, are predominantly helicopter resources and are utilized when all dedicated carriers are busy. Ad hocs represent less than 2% of the total BCEHS transport volume. The member for Peace River North asked a question about Fort Nelson and about a company there. that wishes to provide just the services I referred to BC Emergency Health Services. BC EHS has been in contact with Villiers Air for the past 2 years and has provided information to help them become a qualified ad hoc contracted service provider in the Fort Nelson area. BC EHS further issued a letter to Villiers in October 2020 to support their application to become an ad hoc service provider for BC EHS. The letter was intended to support their plans to acquire an aircraft that could meet BC EHS contract requirements for patient transfers. To date, Villiers has not contacted BC EHS to inform them that they have done so. With respect to improving access to smaller contractors in rural communities, BC EHS is continuing going out province-wide with a request for information for fixed-wing operators in June, and operators such as this one are welcome to participate in that process. The member for Prince George Valemount, the Leader of the Opposition, also asked a question about and an update about automated external defibrillators, AEDs, and where we are right now in the province. So this is some basic information which I will summarize here and then share by letter today with the Leader of the Opposition. Because it's a more detailed answer, an automated external defibrillator, of course, is a safe, portable device anyone can use to identify cardiac rhythms and deliver electrical shocks to correct abnormal cardiac activity. An AED combined with CPR can save the life of someone experiencing sudden cardiac arrest. As of May 31st, there are 2,026 active AEDs in the provincial registry, of a total of 2,909 registered. To remain active, the venue hosting the AED has to keep up with the ongoing maintenance. This is the highest number of active AEDs we've ever had in BC, largely because of the extraordinary advocacy of the government, of MLAs, but of course of the Heart and Stroke Foundation as well. BCEHS maintains the provincial AED registry that helps emergency medical dispatchers connect callers or anyone with the PulsePoint app in their area, encourage people to get the app, with community AEDs. And there are more details, but I'll share that directly with the Leader of the Opposition. And all of this correspondence will go forward to all the MLAs. In some cases, for the sake of time, I'm summarizing these responses. And finally, the member for the Opposition Health Critic asked a question about the availability and the cost of the BC's Cancer's Breast Screening Program in October 2018, and with respect to the breast density change that was made in October 2018. BC began reporting on an individual's breast density in October 2018 on their screening mammogram reports provided through the BC Cancer's Breast Screening Program. The billing codes and fee for screening and diagnostic breast ultrasounds are the same, which equals to $103.90 and includes breast sonogram unilateral, $69.07, and breast sonogram additional side, $34.83. The fee amount includes both the professional fees and the technical fees, and the fee amounts are payable to the diagnostic facility if approved to bill MSP. Screening breast ultrasounds are performed in community imaging clinics and at hospitals. Currently, the known facilities that offer this service are Royal Inland Hospital, Shuswap Lake General Hospital, Queen Victoria Hospital in Revelstoke, East Kootenay Regional Hospital in Cranbrook, Kootenay Boundary Regional Hospital in Trail, the Vancouver Breast Centre in Vancouver, West Coast Medical Imaging in Victoria, University Hospital of Northern British Columbia in Prince George, Mills Memorial Hospital in Terrace, Dawson Creek and District Hospital in Dawson Creek, and the GR Baker Hospital in Quesnel. And I have a more detailed response for the Honourable Member on that and other questions. And with that, Honourable Speaker, thank you very much. It's good to be here today.
Thank you, Minister. And I now recognize the member from Kelowna Mission.
Thank you so much, Madam Chair. So thank you so much for that information, Minister, and for the updates. And I would, will we be receiving all of that as well in written format, or just what you read into Hansard? Okay, perfect. Awesome. So continuing on the BCEHS, we heard of the 283 net new that were hired this past year. So that was 2020, 2021. How many vacancies are there still currently, or is that representative of all vacancies having been filled, and the new postings of 400 net new being posted in July of this year being what will refresh again?
Minister.
Thank you very much, Honorable Chair. Mask off, glasses on. Thank you. And just to put this in context, just in a general sense of where we are and Mr. Picorni is getting information on vacancies for us, so we'll have that shortly. But we added prior to 2020 150 new positions. Under the collective agreement, there will be 490 new positions created. This is under the collective agreement. Fox Conversions, 270 new full-time positions scheduled on call, 220 new regular part-time positions. In 2020-21, 283 net new positions were added to the system, and I described those previously, so I won't go through those numbers. Nearly 400 positions will be posted in July, and 12 additional dispatch FTEs will be added. Recruitment is underway across the province to fill vacancies, and in the first quarter of this year, just to divide up the 273 and what happened in the last part of the fiscal year, 73 paramedics already have been hired in the first quarter of this year. Changes made to implement the collective agreement will neither result in the loss of any services nor ambulances in any communities. Most communities across the province will see an increase in service levels. And I understand there are currently 13 vacancies. The broader issue, as the member will know, and anyone involved in the ambulance system will know, is that the challenges facing ambulance paramedics, and in particular the increase of people who are away on medical leave, is the most significant challenge. Although there is to add 400 positions is a significant recruitment challenge, but it's a good challenge to have, and one that will continue to do what we've been doing for the last 3 years, which is increasing full-time staff in the ambulance service and adding to the resources of the BC Emergency Health Services in BC.
Member.
Thank you, Madam Chair. Through the chair to the minister, how many then retired or quit in 2020, otherwise left the position, and how many are expected to retire within the next 3 years?
Minister.
Thank you, Honourable Chair, and we'll endeavour to get that information to the member. As I said, and this is the response that we will have, and I'll let the member sort of lead through the questioning as she sees fit, but I think the broader question is staff on leave, and which is clearly an area that's increased, and why we need to respond significantly to that area as well. But we're happy to get information about retiring paramedics as well.
Member.
Thank you, Madam Chair. And to the minister's last comment, I agree. And I think that is where we are going. Over the past year of COVID-19, obviously this pandemic has taken a huge hit on our frontline workers, as part of our conversation over the last couple of days has gone. But the ongoing opioid crisis has also had a profound impact on our first responders, and especially and including our paramedics. The Ambulance Paramedics of BC report that close to 25% of members are now off on WorkSafe claims or seeking mental health supports. So through the chair to the minister, can the minister confirm this, and what additional resources have been added to ensure that paramedics have access to the mental health supports that they so desperately need?
Minister.
Thank you very much, Honorable Chair. I think the relevant information, which is delivered in a slightly different way than the member asked, but may be helpful to the member, is obviously sick leave continues to pose a significant problem. It's the physical nature of the work, which I think everyone has understood and has always been in place, as well as significant mental stress that can be part of it. And the member identifies, as I do, and certainly every meeting I have with ambulance paramedics, that it's raised the impact of 2 public health emergencies on the mental stress that can be part of the position. In 2020, 697 paramedics were injured at work, 697, and missed 51,267 days due to injury. And so that is a significant, obviously, loss of term over that time. Obviously, we are significantly increasing both the supports we have to paramedics and doing that work in cooperation under both the collective agreement and our work together with the ambulance paramedics at BC and WorkSafe BC to provide immediate support for paramedics with musculoskeletal injuries, and that's a significant part. BC EHS has also implemented, again, in cooperation with ambulance paramedics at BC, an early referral case management program aimed at supporting workers, paramedics off work, suffering from psychological conditions.
Member.
Thank you, Chair. So I missed some of those numbers, and if I could just ask through the chair to the minister, just if he could speak up just a little bit, because I know the numbers might be very familiar to him, but I'm trying to keep track as best I can. But my concern is this: let's say I think the last numbers in 2018 we had 4,750 total employees under BC EHS, let's say roughly 5,000 today is one of the numbers that's on the website. I don't know how accurate that is. But let's say 25% of those members are on WorkSafe claims or having these types of issues. The number that was just stated, I believe, was 697 that had a form of WorkSafe claim, and we're replacing that 697 with 400. So through the chair to the minister, if he could just clarify, obviously when someone is on a WorkSafe claim, we're not replacing them, but how are we relieving the stress or strain of the remaining individuals at BC EHS with the hires that are being undertaken?
Minister.
Well, the information is that during the course of the fiscal year, in the course of a year, 697 paramedics were injured at work, and that they missed collectively 51,267 days. So obviously, the 697 people didn't miss the whole year, and so this very significant increase in positions will have a positive effect. But some more information about that may be of use to the member. 140, and this is a more relevant number for long-term questions, 140 long-term disability claims were received, with 65 for mental health related issues, 53 for musculoskeletal, and 22 for others. And those could be a whole variety of different things. That the intention, and in collaboration with the ambulance paramedics and WorkSafe BC, we have a Connect and Recover program, as noted. One example of the CAR program is that paramedics can be supported with an employer-covered physiotherapy within 1 day, which is obviously important for people in terms of their recovery. In 2020, as I noted to the member, BCEHS also implemented a significant case management system. So the days are a reflection of the time off that's put in place, and obviously BCEHS is, with this significant increase in resources, really unprecedented in the history of BCEHS, much of which came in consultation with the union and in the period of collective bargaining, but represents very significant increases in the number of positions and ambulance paramedic positions across BC. All of that provides support to the service. But I would say this, that Just because you can replace paramedics doesn't mean we're satisfied with this level of time off. And it indicates, I think, the significant difficulty and stress of this work and why we have to continue to support paramedics who do miss time to get back more quickly. And that's why these programs, both on the mental health side and the musculoskeletal side, have been put in place in cooperation with the union so that we can get people recovering and back to work more quickly, and that is obviously critically important. So it's because this is an important workforce, because of the work people do, because they work in the public healthcare system, wherever it would be, but particularly frontline response workers such as ambulance paramedics. We want to get them well. So it's not just an issue of budget issues and whether we can replace them and whether we've added all the resources. We've done all those things. But it's also a significant fact that we're seeing a lot of ambulance paramedics dealing with both physical and mental health issues. And that requires, I think, prevention. And that work is happening between ECHS, the ambulance paramedics themselves, and WorkSafe, but also rehabilitation from injury.
Member.
Well, you have to give me a second. The mask around the glasses. The glasses are going to get chucked here. Thank you so much, Chair. So to the Minister through the Chair, the number of 140 long-term total or the 697 that were off, how do those numbers compare to previous years?
I'd say we've seen
Minister.
this. Oh, sorry, Honourable
I
Chair.
didn't get the cue because
You
you're
know?
wearing the mask.
I'm wearing the mask, so I'm going to take the mask off. You see, I'm going to get it right. I'm getting it right. I can still actually, as we know, wear the mask, but that might make it even harder. That would be an interesting description where people can't see me as well. I'd say it's significantly up, and what I'll do is endeavor to share with the minister, with the member, and the House detailed information that we have on that year into year. I think what we've seen is a pattern of increased injury over time, and some of that injury, I would say, in the discussions I've had, certainly with both the union and with BCEHS, some of that is how difficult the work is, so physically, but a significant part of the increase, I would say, would be mental health claims regarding the challenges facing ambulance paramedics with what they're seeing, particularly in a period of an overdose crisis, where the repeated coming to residences where people have passed away is extraordinarily challenging. I don't think it's easy for people who don't do that in their daily lives, who may have family members affected by the overdose crisis, but aren't as involved as frontline workers such as ambulance paramedics and firefighters, and of course people in healthcare. I think everyone has to recognize that that is profound, and its effect on people can be profound. And all of us might imagine how we might handle those circumstances, but ambulance paramedics have to live that, and that's why it's very important to support them in dealing with mental health injury, and support them in both getting back to work, but also in recovering.
Member.
Thank you so much, Chair. And I agree with the Minister that this is one of the most difficult jobs. And anyone who has paramedics as friends or colleagues or will know that the stories and what they carry, any of those first responders, it's truly tremendous. One of the numbers that we have located was that in January of 2018, we had 4,750 underneath the umbrella. So in the categories that I mentioned, the emergency paramedics, advanced care paramedics, critical care, so under the whole of the umbrella that we had mentioned previously. And to date, they are saying that that number hasn't changed significantly. We're looking at about 125 new positions now. That might not include all that that the Minister has mentioned of the 283, but having said that, my concern is how was the 400 arrived at in terms of the recruitment process, and what is the attrition rate? If that attrition rate is growing, Are we covering with enough new positions to cover the attrition?
Minister.
Honourable Speaker, these are net new positions, so they would include the positions full and then they're net new on top of that. So there's always a debate in any organization as to whether, doubling the rate of increase in spending and hiring a whole bunch of positions is enough, right? I think, especially in ambulance paramedic system, which unlike a lot of places in the world, these are massive, there are massive coverage challenges in rural and remote communities. There are the BC paramedics and Canadian paramedics in general have to deal with. So that's one set of challenges. So we can always debate about whether it's enough. What's not debatable is that there's been a very significant increase in positions and an increase in full-time positions and a transformation of the service that took place, and I'm very proud to say this, after really the first successful negotiation, freely collective bargain of a collective agreement in a very long time. It really didn't happen under the previous government, and it didn't happen that much under the government before that, if we want to go further back. So there had been, I think, a challenging labor management situation, and we made two changes. One, we gave ambulance paramedics the right to bargain again. And that was a real challenge because they had been part of a wider bargaining association. A lot of people said, well, you've never been able to negotiate before, can you do it now? And that was a challenge to the government, it was a challenge to the ambulance paramedics of BC, and they met that challenge. I think the teams at the ambulance paramedics of BC did a very good job. We said to each other, we can do this, and we did. And the good thing about that increase was it means service improvements. It's right in the agreement. It means support for ambulance paramedics. It's right in the agreement. And we're working with the ambulance paramedics of BC to implement that agreement. And I'm proud of that change because I think I think the other thing about a freely negotiated collective agreement with a group of workers this important is it provides ownership on both sides. A large majority of ambulance paramedics supported the agreement that we're implementing now together, and obviously the government did. And I think that's an achievement, and it speaks well of them because when we come together and agree, it always involves in collective bargaining compromise. It always does. But there's ownership as well, as opposed to some form of arbitrated or imposed agreement or an agreement negotiated by others. So I think all of that is positive, but there's still the challenge of the world out there and two public health emergencies. And I think that everyone would acknowledge what a challenging year and a challenging time this is for ambulance paramedic work.
Member.
Thank you so much. Through the chair to the minister, how many training spots have been added in recent budgets to increase the number of paramedics within the emergency health services? And what is the recruitment strategy?
Minister.
Thank you very much, Honourable Chair. And I'll do two things. I'll share with the member later today, I'll just get it printed off, a copy of a letter sent by, a joint letter sent by BC EHS and the President of the Ambulance Paramedics of BC, Troy Clifford, that is working towards the recruitment of the 400 positions that we'll be posting in July. You can see from the success we've had in adding positions that people want to be ambulance paramedics, and I think that's a good thing, and that this is some of the most important work you can do, and I believe that we're going to be able to recruit for these positions, and that is part of the most significant work that BCHS has. And because we've been adding positions year unto year unto year, they are experienced at the recruitment strategy, the people at BCHS working with the ambulance paramedics of BC. But perhaps rather than talking about those successes, which we can do, I can also lay out from that letter, which is dated from last week, is a joint letter, shows BCHS and QP Local 873 working together, doing what we need to do, which is to having added 283 positions since last year, adding 403 more is still a significant challenge, but one I think we can meet because of the value of this work, because these are really good jobs, although very challenging jobs. And so not everyone, I suppose, is inclined to be an ambulance paramedic because of the difficulty of that work, but I think we will be able to recruit for those positions, working with the union, working with the healthcare recruitment system through the PHSA, working together to see those positions filled. But that joint letter is an indication of the efforts we're making together, not just BCHS, but BCHS and the ambulance paramedics of BC QP Local 873.
Member.
Thank you so much, Chair. So I am just going to restate what I'm hearing from the minister, that in the letter that I will be receiving is the actual number of training, the number of training spots that have been added over the course of the last two budgets.
Minister.
Well, Chair, I think training and the positions are different things. I mean, I've laid out the hundreds of positions that we've added, that the BCEHS has added over the last number of budgets. Those include significant increases in community paramedicine, new positions created, the people recruited, positions now posted, the 400 positions to be posted in July 2021, the recruitment efforts on, and so on all of that stuff, what I'll do is I'll share directly the numbers with the member, but also the joint letter and other things to show the recruitment plan to add what is yet another massive increase in full-time paramedics in BC that's coming.
Member.
Thank you, Chair. Perhaps we're speaking of different things. I was asking about the training spots. So you're talking about the new positions, but those are the same. Are they equal then, through the Chair to the Minister? The training spots and the new positions?
Minister.
Well, ambulance paramedics are trained in different ways, and some of that is training. But when we add positions, obviously people move through levels of experience at the BC Ambulance Service, but I'm happy to share all of the information on that, and we'll do so in advance of the end of estimates. So we got all the details on the hires, all the details on and the letter, so that the member, if she wishes to return to that question, can do so tomorrow.
Member.
Thank you so much, Chair. So of the 400 spaces, what's the anticipated time frame that those will be filled within?
Minister.
So the intention is to add those positions in this fiscal year. So we'll be starting in July and recruiting, and there's a process of recruitment and obviously all the things involved in hiring, but the intention is to add those positions in the fiscal year ending that we're debating, the budget estimates we're debating.
Member.
Thank you, Chair. So over the last several months especially, there have been numerous stories of unstaffed ambulances and long wait times. I understand that there has been a new staffing strategy that's been deployed, but what is the peak number of unstaffed ambulances across the Lower Mainland? And has it ever gone over 30 in a single night?
Minister.
Thank you, Honorable Chair. What I'll start with is just to first talk about outcomes, because outcomes are important. And both before the critical response model that was put in place by BCEHS, and which is we're working our way through now, and after. Response time on purple calls, which is the most serious calls, have been reduced in metro urban communities, in rural communities, and remote communities. And rather than go through all the data, I'll share it with the member, and we'll do that. Red calls have stayed the same in, which are the next level calls, have stayed the same in metro and urban areas. Rural and remote calls have been reduced. So that was the key priority, which was to increase our access to those calls. So I want to give a sense of what people go through, because the number of calls, I think people have a sense of it, and what the different calls are in the CRM model, just to give a sense of what we're dealing with. And that purple calls have stayed relatively stable. That would be expected. These are calls of which are, without putting too fine a point of it, very serious life or death calls, and red calls are themselves serious. Red calls have increased in 2017 from 108,821 to 116,980. Orange calls have also gone up in that period by 10,000, so that's the next level down, so it's purple, red, orange. And then yellow, they've gone up, I should say, from 145 to roughly 155,000, so you see that increase. You think of that as about, I don't know, 7%, 7-8%. And then yellow calls, which is the lowest level of calls, have gone down from 245,000 to 236,000. Sometimes yellow calls, these are the calls, sometimes yellow calls, these are not always the case, but yellow calls are where people don't need ambulances. And we've seen some unusual cases that ambulance paramedics in BC and the dispatchers always speak of, I think, once a year about the most unusual calls they've received, but also, you know, they're real healthcare calls as well. It's just a tiering of it. And the idea of the tiering was to get to the purple and red calls more quickly, and they've done that. On the details of, days and so on, I'm happy to get that information for the member, but there are ambulances obviously out of service. We know this for staffing reasons, especially with changes in staffing, and it's one of, it's a reason in these times why we have to continue to both increase resources to the service and ensure that the service is in place. But as you can see from the substance, over time, wait times in the most serious calls have continued to be very good. And this isn't to my credit, by the way. It's to the credit of the ambulance paramedics of BC and to the dispatchers and the teams at BCEHS. But we have to continue to do this work. There's nothing inevitable about dropping response times. And even in this period, which has been a very difficult period, we talked about June 2nd being the worst, being the largest day of calls that the ambulance paramedics had received, other than 2 New Year's Eves, which are normal days when calls are very high, except for this year. And I just want to leave that out there, except for this year, where changes made around New Year's Eve, which were controversial at the time, did see a very slow day of emergency room. And it's something maybe we should all reflect on next New Year's Eve, I would say, both in support of our ambulance paramedics, but in support of one another. In any event, there's a very serious day, but even on that day, we were responding to purple and red calls within the guidelines of 9 minutes, which is, again, reflects the outstanding work of ambulance paramedics across BC.
Member.
Thank you very much, Chair. I would not agree with the minister that we should have another New Year's Eve like we did this last year. I appreciate all of the citizens of BC that abided by those criteria, but I certainly think it took some of the fun of celebration of a brand new year out of that day. We have a strategic plan that was actually done from 2015 to 2018. Then we also have the stabilizing rural and remote paramedic staffing, report and the community solutions in rural communities. Do we have an updated actual strategic plan for anything past 2018?
Minister.
Thank you. Yes, we have regular reports on progress, which I'm happy to share with the honourable member, and I think they're all publicly available.
Member.
Thank you so much, Chair. And I wasn't actually speaking about reports, I was speaking about a strategic report. There's a strategic report, a strategic plan, sorry, I should say, from 2015 to 2018, but there's nothing past 2018. So just wondering if there was ever any strategic planning that was done for the ambulance service beyond 2018. I do note the minister, with the action plan, there was a progress reports that were being issued. The last one was issued June of 2019. So if that is still continuing, could the minister, through the chair, provide those to the critic?
Minister.
Happy to provide updates. What changed, I think, in 2017 was a very significant increase in resources. That's what changed. So changes were occurring, and have occurred at a number of times with the ambulance service, notably in what we sometimes call the NOTS, the period between 2005 and 2009, under the direction of Minister George Abbott, who brought in the community paramedicine system. There were other challenges at that time. I was the health critic at the time, but those were changes that the minister and I had certainly advocated for together. And then in the period between 2012 and 2017, the average lift for the ambulance service was just over 3%, and obviously in the time of this government, it's close to 8%. So yes, this involves significant strategic planning. And significant strategic planning occurred, and planning occurred after the collective agreement as we are moving towards the current model. So I'm happy to share with the member the reports that we have on that.
Member.
Thank you, Chair. So could I ask why the strategic plan, the new updated strategic plan after 2018, was actually not posted on the BCEHS website?
Minister.
Well, Honourable Speaker, the actions taken are reflected in the dramatic increases in the positions that were put in place. And in many cases, it was a continuation of the aspirations of the previous plan with significantly more resources. And then, of course, the last, and 2 fiscal years ago, we negotiated a collective agreement which supported that as well. So, and as the member will know, we've seen very significant increases in resources, unprecedented increase in resources in the last fiscal year, and more based on an agreement about the workplace with the ambulance paramedics of BC, and there are and we've seen the impact of that both in rural communities and in urban communities, and we're very happy to summarize that. One, obviously, the change in May 2018 to the clinical response model, which was put in place. 2, significant increases in patient care across regions in BC, including, for example, 22 paramedics in the Kelowna area, including West Kelowna and Lake Country, which is great news for people in Kelowna and much needed. If anyone understands that community, which I have not seen since 2019, but I look forward to going back soon.
How many times?
After Tuesday. That's a reasonable date. So, after Tuesday, the possibility, and I hope to have the opportunity to see healthcare workers a little bit around BC this summer in as safe a way as possible. We've been doing a lot of that stuff by Zoom, and it would be nice to provide support, because I think our healthcare workers in Kelowna and everywhere else, but in Kelowna, have done an exceptional job for the whole region. So that's just an example of that period, the 2017 to 2019-20 period, and now we're seeing, of course, significant increases now in addition to that, including in air ambulance services. And as well, we've added new classes. So we've added significant positions in the community paramedicine program, which I referred to before. We've created the rural acute care community paramedics were implemented with wider scope of practice in Campbell River, Salt Spring, Cranbrook, and Prince Rupert. And as well, in 2019, BCEHS implemented an electronic patient record, which streamlines and automates the documentation and transfer of patients between paramedics and hospital emergency rooms. And one of the things that we continue to look at, and has been a significant challenge under COVID, and one way that I think we can continue in the immediate to deal with response times, is that under COVID, the arrival of people in hospital has taken longer. That's understandable because of everything has taken longer for everyone, but we need to ensure protections are in place. And dealing with that situation in our emergency rooms is something we're looking at now as we review access to acute care, which will include issues. We talked a little bit in the estimates of the Leader of the Opposition about visitation and long-term care, but there are also issues of visitation in acute care and access to acute care hospitals. But those have affected, I think, in terms of ambulance paramedics and the amount of time they spend with patients in that process, they've increased that time. And hopefully, as we move through this time, we can continue to do that safely, but do it in such a way that will reduce the time burden on ambulance paramedics, because we don't need ambulance paramedics at emergency rooms longer than absolutely necessary. But it has, clearly the COVID pandemic has affected that aspect of the work.
Member.
Thank you, Chair. So we have a strategic plan that was done in 2015 to 2018. Then we have the action plan that was done in 2016 based on the strategic plan that we had then progress reports issued for. And it's easy for us to kind of track the progress over the course. In fact, actually on the BCEHS website, you can click through every single report and see what actions were done. I'm listening to the minister's different initiatives that have been undertaken, but without a strategic plan, what is the minister, and this is the question through the chair to the minister, what is the minister using as the main deliverables that are targeted for the time beyond 2018, so from 2019 to 2021, 22?
Minister.
Well, thank you, Honourable Chair. And I think one of those major deliverables, improvement in services and the development of permanent positions across rural British Columbia, which is something that I think rural British Columbia has long been waiting for. And we heard from some of the members of the opposition yesterday and members on the government side as well, who've been calling for that. So we've had a significant increase in resources and a transformation of resources in the schedule on-call model that has been put in place. In addition, of course, the emergency response model has been put into place. In addition, we've enhanced and dramatically expanded previous initiatives, and we negotiated a collective agreement. And under that collective agreement, there was joint commitments to implement the schedule on-call model, to convert Fox shifts to regular full-time positions. And the intent of these changes, which is part of the plan that we came up together with our workers, because a lot, as everyone in BC knows, the relationship between the ambulance paramedics in BC and the government of BC in the period from 2005 to 2016 especially, it got a little bit better in 2016 I'd say, was not very good. The only group of workers who didn't get the bonus, I think, in the entire public sector in 2007 to 2009, what was sometimes called the Carol Taylor bonus that people will recall. The only group of workers that were not provided that by the government of BC, ambulance paramedics. Can you imagine, Honourable Speaker? And so we negotiated a collective agreement that works together to increase 24/7 paramedic coverage to improve service delivery and patient care, improve recruitment and retention of paramedics, improve the health and safety of paramedics. The day-to-day implementation of these initiatives is being closely monitored and overseen by emergency physicians within the BCEHS. In 2020-21, 283 new positions added, Honourable Speaker. Over 1,000 on-call staff are now receiving health and wellness benefits as well as earned vacation time. A night shift premium was implemented for all paramedics and dispatchers to help with staffing hard to fill and weekend shifts. And we can talk about the schedule on call program. This is a period of extraordinary reform, not my reforms. the reforms of the BCEHS and the reforms that we negotiated and worked with and put in place, transforming a relationship that had been poisoned to one where we negotiated a successful collective agreement and are working together to recruit significantly more paramedics.
Member.
Thank you so much, Chair. So with all due respect, I'm listening to these initiatives, and those are spectacular initiatives and commendable. And I reflect the eagerness and the excitement with having treating the paramedics and the frontline staff with such respect. I absolutely commend. My curiosity and my questions have actually been around a very different topic, which is strategic planning, which is a big picture, very 30,000-foot, 50,000-foot level for us to take a look at the crises that we've endured, whether it be the opioid crises, which is really 5 years, 6 years almost, under an emergency situation, but certainly not in the making, as well as the pandemic that we've just endured. We've got 25% of our workers in the paramedic staff that are actually suffering through some form of mental illness or supports, etc. How are we as a collective dealing with the strategic planning of such a vital service for our citizens? So my question through the chair to the minister will twist a little bit. Understanding that we haven't had a strategic plan from the course of 2018 on, are we now in the process of creating a strategic planning for, let's say, 21 to 24, which would be a logical assumption, considering that would probably be when the next election would come?
Minister.
Well, Honourable Speaker, these changes are not one-year infusions of funds, which the health system regularly has received in the past in advance of an election. They're permanent changes. And regardless of whether I'm Minister of Health, someone else is Minister of Health in future, we'll be building on those successes. And so what we've seen, I think, in all these areas, for rural and remote communities, a significant plan put in place on April 20, 2020 and implemented. So to say to the member, I don't have great memory for dates, but that's my birthday, so there you go. So I remember working and doing that on my birthday. That's why I know the date of that. It's not some sort of weird memory about dates in any way or something written down. So what you've seen is what we need to do, which is deal in a more difficult world with 2 public health emergencies, with communities that need and are crying out for more transit in many cases and harder to get around, a strategic plan that adds resources and that moves us to a model. And part of that, of course, is the schedule on call model. So I think we're working on the basis of a plan to improve service for British Columbians and to build a paramedic service that was, I'd say, had 1 foot in the past and 1 foot in the future. And some of the steps to get us into the future took place under the previous government. We took some of those steps, added to them, and have provided the resources. And the collective agreement and the schedule on call model is a significant part of that. And as Mr. Clifford and Ms. McKinnon, the Chief Operating Officer, has said, it represents a big change to the way we work, but is one we feel is positive for our service and for the communities and patients we care for. And so with these hirings, and a key part of these hirings, and the member will see this, is a series of communications with ambulance paramedics themselves and significant consultations so that they can support the effort of recruitment. But I think that path is a good path. That's the path of more ambulance paramedics, more ambulances, more full-time ambulance paramedics and full-time positions in rural and remote communities, and significant hiring, not because for hiring's sake, but for the obvious needs of a service that faces challenges and that needs to improve service, but also faces challenges that some of which we see on the news.
Member.
Thank you very much, Chair. So I agree. I agree with the minister. I agree that we are seeing stories on the news. I agree that we are hearing communities crying out. I agree that we are hearing paramedics reaching out. and asking for support. I also agree that we are fighting, forgive the analogy, we're fighting fires with increased staffing measures and some of the new initiatives. My question is this: without a strategic plan, how does the minister actually assess success?
Minister.
Honorable Chair, we are operating on the basis of a plan to improve services and to transform the service and bring it into the 21st century. We're a little along into the 21st century to do so, but we're doing that, and we're doing it with our partners, the ambulance paramedics of BC. And that involves a dramatic, unprecedented investment of money in the service. We haven't seen this in decades. The negotiation of a collective agreement, the transformation of rural and remote paramedic care, which is so important for people who live in rural and remote communities because of the distance many of them have to travel to healthcare facilities. It's very important. The significant transformational change of adding positions and making this not temporary work, not partial work, not on-call work, but full-time work, which is a remarkable transition. All of these are part of the plan we're taking forward, and I think it's a good plan. And not all of the ideas are mine, and not all of them started with me, or didn't all start when I was Minister of Health. What I do, and I think everybody tries to do this, what I do is I take good ideas wherever they came. I don't care. In fact, I'm delighted to credit George Abbott every time I mention this. I don't care that he created community paramedicine. I think it's a good idea. We've added community paramedics, and I believe we need to add some more, and that they stabilize the system around BC and they create in paramedic work the kind of work that is family supporting, and I think that's a good thing. So we have a plan. You see us delivering on this plan. That plan has elements, including the response model. That plan has elements, including working with other first responders. That plan has elements, including increasing resources, and a detailed and obligatory move towards the increase in full-time positions that was negotiated and agreed to at the bargaining table with ambulance paramedics. What a change that is, from toxic to working together on agreement.
Member.
Thank you so much, Chair. So what happens in a strategic plan is that you create goals, strategic priorities, and then you also create deliverables. And with deliverables, then you can measure your success of initiatives against deliverables. Without such a plan, it's not a form of accountability. So to the minister through the chair once more, will the minister look at delivering a strategic plan for BC EHS for 21 to 24?
Minister.
Thank you, Honourable Speaker. There is a plan. You can see it being executed now. I mean, one element of that plan right now is the 400 positions we're posting at the beginning of July. 400 positions based on planning that involves communities in every part of BC. That's a plan, Honourable Speaker. Negotiating and changing the relationship with our employees and negotiating a collective agreement, that's a plan and execution on that plan. There is measurements on that, including response time measurements in the response model that we see, and that on purple and red calls have seen progress in a very challenging time for ambulance paramedics when the overall number of calls has increased. That's the plan. I think the member, so there is a plan, and the member says, well, it needs to be a strategic plan. Well, I think that plan's pretty strategic too.
Member.
Oh, a singer at the end. Thank you, Chair. According to the 2020 to 2022-23 PHSA service plan, and I quote, over the next 2 years, BC EHS plans to increase the number of community paramedicine patient visits by increasing the range of patients that can be seen through the program and the range of patient referrals that can be managed through supporting deliverables such as home health monitoring, end quote. Understanding that COVID has impacted all aspects of healthcare, to what degree were these patient visits increased?
Minister.
Thank you. And what I'll do is I'll provide that information to the members so we're not stuck on that. But I would say that, and some of the work of community paramedicine, just like all home health support, some of it has gone more virtual in this time. I think we all understand that. And so sometimes the number is like what's an at-home versus what's a visit, right? So we'll be happy to provide that to the member. And I think that part of the plan that the member has just laid out, which I'm delighted about because, of course, I hadn't mentioned it, so I was delighted to see that, is a reflection, I think, of that program. Right? Again, a program that was created and was transformative for many, many people, and where we've consistently hired people into that. But we also want to make that work worthwhile, because the purpose of community paramedicine, beyond its creation of positions that are family supporting positions that people can take in communities around BC where the number of calls may not justify necessarily the creation of a position if workers aren't doing that work. Also help us stabilize staffing, of course, but also allow us to reduce 911 calls through the exact kind of home monitoring we're talking about. So I think that program, I can tell the member, has been extremely successful. I was happy to celebrate, I think, the 10-year anniversary of the program with the former Minister of Health, Mr. Abbott. There have been a number of ministers of health since then. There was Mr. Falcon, Mr. Lake, and others, and then there's me, who were part of that, and were part of that celebration as well. And I think that program continues to be successful, and that's why we're going to continue to expand it. So the purpose is to, of course, stabilize ambulance services in rural and remote BC, but also provide services for people. And I think the program is being very successful, as have most of our community-based health services programs, which have significantly expanded over the last number of years.
Member.
Thank you so much, Chair. And this will be my last question, and then we're going to move on. I'm just telegraphing this. We'll move on to capital expenditures, and I'll start calling on some of my colleagues to ask some questions as well. This is being my last question. I'll make it really quite an easy one. Through the chair to the minister.
I can be the judge of that.
Okay. What is the protocol for paramedics to transfer patients to the hospital? And what are the current wait times for admitting? And I know that we had talked about this a little bit, not necessarily just under COVID-related times, but are there system improvements outside of the ones already mentioned, like the electronic records transfer, under consideration?
Minister.
Thank you, Honourable Chair. And I think I responded to this a little bit in the previous question, which is that obviously the handoff has to occur, and the challenge occurs when emergency rooms are facing COVID protocols 1, and where emergency rooms are also busy, and that can of course that coincides with the times when ambulances are busy. So those issues of protocols now that we're entering new phases of COVID is one of the issues we're looking at, because we want to see those times reduced. I would say in general, they were flat in the COVID-19 period, increased because of the protocols, decreased because of a slight reduction in overall calls, although there's a severity of calls in the 2 public health emergencies. And what's happened more recently is that we continue to have protocol challenges, and now, of course, we have a return to more normalcy in terms of emergency room visits, about the same, but on some of the same days as you would expect, that there were a lot of ambulance calls, there are also a lot of emergency room visits. And so that work is being done right now, and I'd be happy as we work through this with the teams that run our emergency rooms and acute care service, the improvements, I'll be happy to brief the honourable member.
Recognizing the member from Kamloops South Thompson.
Thank you very much, Chair, and I do appreciate the opportunity to weigh in with a couple questions during health estimates. I appreciate the time that I've been allocated from the official opposition health critic. And there's a little bit of context or background to my question, so I'll get right at it. On October 6th, 2020, the member for Kamloops North Thompson and I, as BC Liberal candidates in the provincial election, promised that our party, if elected to government, would invest in two linear accelerators for enhanced cancer treatment at Royal Inland Hospital in Kamloops. This investment would allow cancer patients in the interior to receive their radiation treatment in Kamloops, saving countless parents and their loved ones at the added stress and expenses incurred by having to make a trip elsewhere. 11 days later, on October 17th, 2020, the Premier came to Kamloops to also make a big announcement during the provincial election campaign. The Premier promised the people of Kamloops and area that a re-elected NDP government would establish a new cancer care clinic in Kamloops within 4 years. The Premier said, and I quote, "The services will be prepared and be delivered within the mandate of the next government, absolutely," end quote. Then when asked by Radio NL host Howie Reamer live on radio on February 5th, 2021, so after the election was behind us, the Premier was asked to confirm that the new cancer clinic would indeed be opening its doors in Kamloops within 4 years, as he had promised during the recent election. And the Premier said, and I quote, "I have made that commitment and we're on it. That means business plans are being developed. That means that the Treasury Board is looking at the costs. The commitment we made during the campaign stands," end quote. Enter the Minister of Health, who has made numerous public comments about the cancer clinic commitment, saying, for example, on Radio NL on January 27th, 2021, and I quote, "What we committed to in the election campaign is a 10-year cancer plan." And of course, there was, end quotes, and of course, there was no mention of the Kamloops Cancer Clinic commitment in the recent 2021 budget. So my question to the minister is this. The Premier clearly promised a cancer clinic would be built in Kamloops within 4 years if the NDP were re-elected. In contrast, the minister has consistently refused to reaffirm that commitment, referring instead to the provincial 10-year cancer plan. Obviously, the people of Kamloops, the Thompson Valleys, and the surrounding areas that are served by Royal Inland Hospital are confused and concerned about these contradictory comments. To the minister, who are the people of Kamloops and the region supposed to believe? The Premier, who said the cancer clinic, definitively said the cancer clinic would be built and open in 4 years, or the minister who keeps saying that the cancer clinic commitment is part of a 10-year plan?
Minister.
Thank you, Honourable Chair, and to my friend from Kamloops, I would say first of all that because he didn't take us back to the 1990s, I'm not going to say anything about the intervening period between the 1990s and 2017 on cancer care, except to say this, that I think these are important services, our capital programs that we put in place over time. And when I became Minister of Health, one of the first decisions I made, Honourable Chair, we have a new chair. Welcome to my friend from Richmond, who's now in the chair. That one of the first decisions I made was the continuation of the next phase of the Royal Inland Hospital redevelopment project, which was really a remarkable project. It's being built now, and it's just fantastic. It's going to make a huge difference for people in Kamloops. And I spent a lot of time focused on services in Kamloops. The member will know this. Our first urgent and primary care center, our family practice learning center, the support for primary care in the area, the increase in the number of MRIs, the increase in the number of surgeries, all these things in Kamloops, because I see Kamloops as, and because of its role in serving a whole area, is vitally important. And I think these are projects, these major projects. That particular one, the one at Royal Inland, started on the previous government. I've taken action, we've continued it, and we're still building it. And I suspect when it's finally finished, I dare say to the member for Kamloops South Thompson, it's possible that I won't be the Minister of Health opening it. It's just the way these things go, right? And with respect to cancer care across the province, the government will be presenting a 10-year cancer plan that deals with a number of aspects. Some aspects are ones of service, because we're going to see in the coming period, because of our aging population, a significant increase in cancer diagnosis. And because of our improvements in cancer care in BC, we're going to see people more living with cancer, which is, I think, a joyous and wonderful thing. But it presents, obviously, challenges in the system, but it's a joyous and wonderful thing. People are living longer with many cancers, and that's because of the great work in our healthcare system and because of the prevention work we do together. Prevention work such as the lung cancer screening program that we've initiated, the colorectal cancer screening program started by the previous government. One of the things I believe really strongly is the need to add services. So we've added diagnostic services for cancer, for example, in Kelowna, for example, in Victoria, which have meant that people can get services in those communities closer to home. And I think that's an important thing that we got to continue to do. That everyone understands that not every community can have a cancer center, but I think we have to do what we can at the time of one of those diagnoses that everyone remembers. They remember the day and what they were doing when they learned that a loved one has cancer. And obviously people who have that cancer diagnosis themselves have that feeling. So I believe that it should be part of our 10-year cancer plan to add cancer services in other communities. And in the election campaign, the member refers to Kamloops, and we also spoke about Nanaimo as well, that we wanted to expand services, and this is important for the people of Kamloops, but also people of the entire region, and that's what we propose to do. We're also adding a cancer center at the second Surrey Hospital, and that has received a new Surrey Hospital, and a cancer center is being constructed. It has had its business plan approved and is moving forward now, and we may have occasion to talk about that as well, and I just can't wait. I think I could talk all day about that new proposal and maybe all night. And so I believe strongly that Kamloops should have a cancer center. And what does that mean, right? Because I think that there's always a debate, what are the services, what do you mean by a cancer center? So I want to say that it will be so that people can visualize it, and the member and his colleague from Kamloops can visualize it. It will be similar to the one already operating in Victoria on the site of Royal Jubilee Hospital, and the one that's being planned to be integrated into the new Surrey Hospital. These cancer centers have exam rooms, chemotherapy treatment spaces, linear accelerators for radiation therapy, and advanced diagnostic imaging. That's the core of it. They're obviously, like all health capital projects, I mentioned the project, the Royal Inland Project, which I believe was started under the health minister prior to Terry Lake. I've got to get the orders right. The member will know. And then continued under Terry Lake and continues under me. They take some time, but nonetheless, it's our intention to proceed. They're complex projects. They do take years to deliver, but it's our intention to plan and deliver that in the context of a 10-year cancer plan, which is not just about building capital, building new cancer centers, but about providing services across BC. And I think what we're doing is developing, in addition to that, plans in the interim to improve services in those communities. So as we build out the capital build for such a project, which is significant, and those are large-scale projects, and the member will know this very well, that we intend to provide clinics, perhaps of the type that he described. Now, I'm not sure, Honourable Chair, and I say this with delicacy to the Honourable Member, that the decision to proceed in a 10-year cancer plan with a major decision to add services in Surrey and Nanaimo and Kamloops was made because of an announcement that he made in the campaign. So I just say that with delicacy, but he will understand that that's a debate that he and I may have, but I don't think it's the important debate. The important debate is what we need to do is move to improve cancer care for the people of Kamloops and the people of BC, and that's what I intend to do. And the Kamloops Cancer Centre, when we announce the full plan, the member will see that, and we'll proceed from there.
Member for Kamloops South Thompson, do you have a follow-up question?
Yes, I do.
I recognize the member for Kamloops South Thompson.
Thank you, Chair. There's a lot to unpack there, and there's certainly, when the minister refers to delicacy, there's nothing delicate about what was a very clear, very stark commitment that the Premier made to a cancer care centre in Kamloops that would be open by the end of a mandate, a 4-year mandate, should he be successful in the last election. He was successful in that election. And so the question that I asked was not the broader details of a 10-year cancer plan, with all due respect to other communities that really do need enhanced cancer services like Nanaimo, like Surrey, and so forth. As one of the representatives for Kamloops, my responsibility is to, as the minister knows very well, is to stand up and advocate for the needs that exist in my community. And it was the Premier who came to Kamloops and said very clearly that Kamloops would be the site of a cancer centre that would be open within 4 years. I'm not going to take an opportunity to go back to the 1990s for the minister's benefit there. But I will say that I kind of wish he would talk about the intervening years. The work that our former government did in Kamloops. We invested over $625 million in Kamloops in the 16 years that we were in power. That included the $80 million clinical services building, the $417 million patient care tower, which the minister mentions was actually a project that was initiated and business plans done and funded under our former government. And we're obviously very pleased that the current government has carried on with that project. But we provided enhanced funding for operating rooms, for an entire second floor redevelopment, the $17 million Hillside Tertiary Mental Health Center, and intensive care units, medical device reprocessing redesigns, on and on the list goes. So the minister often likes to, and I say this with all due respect, likes to insinuate that if the BC Liberal MLAs had really been advocating, we would have been advocating for enhanced cancer care sooner. The reality is we advocated for what the community's top priorities were in healthcare, and those priorities were delivered. The next most important, one of the next most important services is cancer care, enhanced cancer care. And it wasn't me that stood up in Kamloops and promised on October 17th, 2020, that a cancer center would be built in 4 years in Kamloops. It was the Premier. The Premier has said that in fact Treasury Board is working on it. That the Treasury Board is looking at the costs. So my question to the minister would be this: first, can he confirm that the Cancer Care Centre is actually for Kamloops is actually at Treasury Board, as per the Premier's comments on February 5th, 2021, or did the Premier misspeak? And secondly, back to the fundamental question here, the minister talks about a 10-year cancer plan. The Premier has consistently referred to a 4-year window for the build and opening of a cancer center. The minister and the Premier both can't be right. Someone has to be, obviously is in charge here. So is it the Premier's 4-year commitment for a cancer center to be opened, or is it what the minister is saying, that we won't see a cancer center in Kamloops within a 4-year period, but rather it will be delivered within the context of a 10-year cancer plan? And that's my final question, and I thank the minister for his time.
Minister?
Well, thank you very much, Honourable Speaker. And the member for Kamloops South Thompson used the term insinuate. I don't think, saying anything of the sort. What I was saying and what I said is that what I was reflecting on was that these major projects involve governments and they involve communities. I'm very, very proud, and the member will know this, of my record of advancing capital projects. I'm very proud, and I don't think this is going to win me any honorary membership in the BC Liberal Caucus, but of the projects we've delivered in ridings represented by Liberal members. And we've done that consistently across the board, and members will know that because, the hospital was built in Dawson Creek in 1959, and we needed a new hospital, and we're delivering a new hospital. And that's a good thing. And that's the same view I take for Kamloops. I have been an advocate for healthcare in Kamloops. The member will know this. When I was the opposition health critic, when I was leader of the opposition, I advocated for Kamloops with passion and consistency. I have a little spot in front of Ponderosa Lodge where I held forth many, many times on those questions, and I talked to people and engaged with people in Kamloops all the time because I took it very seriously. And I also, and I say this again delicately, but not delicately in criticism of the honourable member, I think he misunderstood this, but partly because I enjoyed press conferences with Angelo, and I know he did as well, and I think about that all the time. We're proceeding with a cancer centre in Kamloops. We're proceeding with a 10-year cancer plan. Improving cancer services in Kamloops and developing a centre like the one I've described. And the member can go to the one in Victoria and see what I'm talking about in bricks and mortar. Is something that the government's committed to, I'm committed to, the Premier's committed to, and we're proceeding. And we are going to deliver the details of that 10-year cancer plan soon. But this is part of the capital part of that. There's significant other parts of that that include prevention and services in communities across BC, and led by the teams at BC Cancer. So I think that's the answer the member wanted. The answer is yes, we're proceeding, and he's going to see more details of that when we present publicly our 10-year cancer plan, and he will know, as an experienced former member of the Treasury Board, that such a proposal, well, I can't comment, and he'll know this as well, as about the proceedings at Treasury Board. I'm a member of that Treasury Board, and I'm Minister of Health, and I can tell him that we're proceeding with a 10-year cancer plan. We're going to have a new cancer centre in Kamloops. We're going to have one in Nanaimo, and none of that's going to be announced without the approval of Treasury Board.
Member. Sorry, my apologies. Member for the Kamloops South Thompson, do you have a follow-up question, or are you finished?
No, I don't have a follow-up question, Chair, but I will say that, again, the Minister did not answer my question. The Premier has said 4-year time frame for this cancer centre in Kamloops. The Minister is skating all around that and keeps referencing a 10-year plan. That's not the same thing that the Premier committed to the people of Kamloops and the surrounding area. But that's it. I don't have any further questions at this point. Thank you.
Minister.
Thank you, Honourable Chair, and I understand, and I look forward to also meeting in person with the member, because I think this is an important thing for people in Kamloops, and I think I hold, as the member will know, I hold him in high regard, and we've worked together on projects before, and I think this is a project that isn't just about a government or a party, it's about the whole province and the community. What we announced in the election was a 10-year cancer plan. The Kamloops Cancer Centre, the Nanaimo Cancer Centre, will be elements of that plan. We've committed to that, and it's my job as Minister of Health to deliver on that, and I intend to do so because I profoundly believe that delivering cancer services in different parts of the province is valuable. So, and I think, and I may be wrong, but I think the member agrees with that. So I'm absolutely not implying, because he has criticism of it, he doesn't support the Kamloops Cancer Centre. I know he's an advocate for that, and I look forward to working to him to deliver on that for the people of Kamloops and the people of BC.
Recognizing member for West Vancouver, Sea to Sky.
Thank you, Chair. And first of all, I would like to thank the minister for his interest and assistance in getting the Squamish Hospice across the line. He mentioned it yesterday in estimates, and I think he knows that the community raised a tremendous amount of money. In fact, significantly more money than was originally asked for, and then even then, that turned out not to be enough. So I do want to thank the minister for his efforts in ensuring that the community efforts were not in vain. To me, the takeaway there, however, was that design requirements and the procurement process were problematic. The cost of this renovation was in excess of $2.6 million for 4 beds and some a nursing station and that sort of thing and a quiet room. But nonetheless, it's $2.6 million for 4 beds in an existing facility. And that's an awful lot of money. And the budgets were, I think, about $1 million less than that originally. But part of the reason the costs were so high was that local contractors, I understand, were not eligible to bid due to exorbitant and virtually unattainable amount of insurance that they were required to have. And this was really only attainable to the largest companies. And so the bids were very limited. And I guess my first ask would be that the minister review the circumstances of this particular project and see if there's things that we can learn from it. And can we make these projects more accessible to local contractors? And I think not only would spreading that opportunity to local people and businesses, but also I think the benefit here would have we could potentially have a significantly lower cost to some of these projects, and I'd be interested in the minister's comments on that.
Minister.
Thank you very much, Honourable Chair. It's very good to see you there. And thanks to the member for his question. The member approached me on this file because of the need for additional government support to make this extraordinary local venture happen. And he brought it to my attention, and we worked on it, and we delivered on that. So I really appreciate it. I think I do recall meeting with him, I think, in the legislature during our mutual House duty, which of course should be voluntary, but is mandatory in any event. And so we took the opportunity to do that, and he made the case eloquently, and we responded, and we got that. So I agree, and I want to acknowledge and appreciate his efforts on that. And hospice is something that is, I think, a labor of love in communities around BC, and what happened in Squamish, that was reflected in his community, shows that. There are high standards for healthcare facilities, and they present significant cost challenges, and we see this all the time. One of the things I would say, though, is that for large capital projects, there's relatively few people who can deliver that. You're only going to get a certain number of companies who are able to build on a project as extraordinary as St. Paul's. It does seem to me on smaller capital projects we can figure out other ways, and sometimes we talked about this, and I'm not going to get into a community benefits agreement debate, so I'll leave that to one side. But I would say to the member that I would be interested in his suggestion, and I look forward to hearing the details of that story he describes with respect to Squamish. And I'll endeavor to take a look at that issue as I did the previous one and get back to the member. Well, Chair, if I may, and I apologize, one last thing, and I apologize to the member for West Vancouver Sea to Sky, but I have an answer to a previous question from the member from Kelowna Mission, so I'll just provide that. That our target for this year for community paramedicine visits is 24,000. We achieved 18,000 this year, which was slightly less than in 2019-20 when it was 18,661. In 2018-19, the number was 14,889. And what I'll do is when we provide other detailed information, because I want to make the member write all these things down, and that's the only times you get to look at the answer record. This will be included in that answer, but I want to give her a sense on community paramedicine. 14,889 in 18-19, 18,000 this year, 24,000 in 21-22, And our target, and that's why we're doing this review and expanding the scope here, is 30,000 in 22-23.
Member for West Vancouver Sea to Sky, do you have a follow-up question?
I do. Thank you, Chair. So the minister is aware, the previously mentioned hospice is attached to Hilltop House, as part of, which is also attached to Squamish General Hospital. And my questions are about long-term care and acute care in the Sea to Sky. Hilltop in particular, as of a couple of weeks ago anyway, had a 35-person wait list. And as the minister knows, there's really only one way space frees up at these long-term care facilities. And so waits can be very long. I know from personal experience, it took, I think, over 2 years to get my uncle into Hilltop. And really, the options, there are no other options. If you don't get into Hilltop, you're going to Vancouver, going to Metro and perhaps beyond Metro Vancouver. That is just the way it is. And Squamish, while Squamish is an hour away, the northern parts of the riding and many of the First Nations, the Lilwat, Naquatqua, and Inshuksh in particular, means that if you're not at Hilltop, which is already several hours away, and if you're into Metro, you really have no access to their elders or seniors. And we have, I'll remind the minister, no regional transit services, despite many years of efforts to see that come to fruition. And I heard from the Minister of Transportation yesterday, I might hear some good news in the near future, and I will hold my breath. However, we do, if your relative ends up in Vancouver, they disappear into the system, and it's really challenging to access them and support them. The region's also growing quickly, I think, as the minister understands, and the demand for both long-term care and acute care continues to grow. After a significant amount of time in terms of denying we need much in the way of expansion, VCH, I understand, has now agreed to a regional review for particularly acute services, although I hope that includes a long-term care assessment as well for the Sea to Sky, which is I believe was to start last fall, but that I think is understandably delayed, although it doesn't look like it's going to start again until next fall, so maybe another year before we see an updated regional plan. Some of the things that are happening, the minister, I'm sure, is aware of perhaps aware of the CAT scan that the community supplied essentially in Whistler has aged out and will need it to be replaced. And I understand the new location would likely be Squamish Hospital. But again, you don't want to put in a CAT scan and find out it's in the wrong place. So we do need that longer term vision. The Squamish maternities are at a record level and show no sign of slowing down. Despite COVID, the Whistler Healthcare Center it remains busy and will, I think, be right back up to the numbers we saw previously in short order here. And we do appreciate the opportunity that's been provided in terms of upgrading the trauma room. The other issue is that family physicians, particularly in Whistler, I find it a real challenge to maintain an economic practice. And we've seen several clinics as well as private practices close down just because the economics don't support family physicians. And so all of these things are concerns for the region. And I hope the minister, or I wonder if the minister could ensure that we can have confidence that this planning process will be advanced rapidly, that it will be robust and encompassing enough to consider all the various healthcare issues in the Sea to Sky, which I think we all somehow think is part of, sort of part of Metro, but parts of the region are very long way from the city, and having to go to even the new St. Paul's is very challenging for many people, and services in the region are needed, and we need to plan for them. So I thank the minister and look forward to his response.
Minister.
Thank you very much, Honourable Chair, and thank you to the member for his questions. I think, the opposition health critic will excuse me, I'm sure, for putting this in the context of broader initiatives, because I think the questions that the member have also reflect other constituencies. First of all, I want to say with respect to seniors care and Hilltop House, I agree with the member. There's two sets of things that need to happen, it seems to me, in our long-term care facilities. If we look at them across the board, across British Columbia, what we see is a lot of healthcare owned and operated care homes. And the increase, when the previous government increased beds, and this is just what happened, they principally increased beds through private providers. They did between 2001 and 2017. And there wasn't a lot of investment in healthcare authority owned and operated. A lot of our health authority owned and operated care homes as a result of that, and you could argue lack of investment by other governments as well. I mean, we date from a significant period ago. And so what needs to happen at Hilltop House, I think, is that we need to ensure that it meets 21st century standards, because these are our seniors living at Hilltop House, first of all. And secondly, we need to, and this is not as much of a problem at Hilltop House, if I remember correctly, I think there aren't too many multi-bed rooms, but frequently our older health authority owned and operated care homes tend to have multi-bed rooms, and those don't meet modern standards, and we've saw across the country, less so in BC, but across the country, the impact of infection in multi-bed rooms. And our family's quite familiar with multi-bed rooms because the loved one lives in long-term care with 3 other people in her room. And so we need to invest in long-term care as much and as importantly as all the other work, the raising of standards we spoke about last week, the need to hire staff and deliver services. We've got to rebuild our existing long-term care homes and add beds. And Hilltop House is certainly one of the care homes under consideration for that. There is a significant initiative coming forward. A lot of our capital expenditure in the first number of years and the projects we promoted have been in acute care, and you can see that through the large number of hospital projects. But I think the capital priority incrementally, and that this is true in Richmond, where we're going to see significant investment in long-term care, and in the next number of years, is true in communities across BC, and it's true at Hilltop House as well. So I see that as obviously meeting the need to both renovate and improve and add resources to Hilltop House. I believe that to be true. That's not mean I'm making the announcement today. I say the member for West Vancouver Sea to Sky. There's no press release in the offing, but it's a priority as we look and we significantly expand our capital project in long-term care. So just to say, I agree with them. There's clearly demand, and we need to make the care better. And part of that is, of course, operating, and part of that is capital. And with respect to capital, Hilltop House seems to me to be a priority in BC. There are others on the North Shore that one could imagine, and I know there's a continuum of service. Obviously, we're building a new patient tower at Lionsgate Hospital, but there's other significant public health investments in long-term care on the North Shore. I'm thinking of Berkeley and thinking of Evergreen that are both in the same circumstance, I'd argue, as Hilltop. So those are the kinds of things we're looking at in the next little while. And so the member's question and his advocacy comes at a good time. In terms of primary care, the Whistler and Sea to Sky Division of Family Practice is working right now with Vancouver Coastal Health to start planning for the primary care network in Whistler Sea to Sky. And I think what we're looking to do, as you know, is build out team-based care across the province. And in my view, from Whistler, Pemberton, back through to the North Shore, where we do have an agreement with the local division of family practice, say in North Vancouver, is ideally suited to the development of a primary care network. And it's my expectation that that will be part of our work in the 21-22 fiscal year. And I'd recommend the member endeavor to meet with his local division of family practice, because this is a partnership. We're working, I don't believe that you need to add services that may lead to the closure of existing services. You need to add and support that. So the putting in place team-based care is something we can do together. So I think on long-term care, agree with the member. On Hilltop House, I agree with the member. And we are pursuing primary care networks, which I think will address many of the other questions raised by the member in terms of primary care.
Member for West Vancouver Sea to Sky, do you have a follow-up question?
Just wondered if the minister could comment
Okay.
on the strategic plan for that's been committed to by the VCH for the provision of acute services, as well as, and I agree with the minister on the family practice on the team-based care. I think that's something that we've long been looking at over the last several years, certainly in Whistler, to try and put in place a team-based care model. It just due to efficiency and we think at the end of the day it provides better service. But overall, is there a commitment? Is the minister aware of this, of a commitment to the creation of a more of an acute care strategic plan for the Sea to Sky, recognizing the growth and activity in the region? And also, I wonder if the minister did have a response, or perhaps he made it earlier and I missed it, with regard to my questions about BC Ambulance Service reallocations of shift patterns from full-time to part-time.
You good? Are you good?
I'm up.
Okay. Minister. Oh, yeah, please ask.
Thank you, Honourable Chair, and the member for Kelowna Mission suggested that I reread the answer.
No, I did not.
But I want to say to the member for West Vancouver Sea to Sky, I will be sending him this answer in writing as well today. But it's also in the Hansard record, my response to his questions about paramedics in Whistler, in Squamish, and in Pemberton. I'll also add to that a second letter about an update around VCH's acute care planning. As you can see there, we're looking at progress both on the primary care and the long-term care side, as well as on the ambulance paramedic side. So I think that reflects the growing needs of people in his constituency. So I'll leave it there and not reread it all into the record.
Now recognizing Richmond North Centre.
Thank you, Mr. Chair. Why there was a passing mention of the hospital in the budget? There was no funding or timing given for Richmond Hospital's new acute care tower. Can the minister, through the chair, tell my constituents why they were left out of the budget?
Minister.
Thank you very much, Honourable Chair. People of Richmond are in no way left out of the budget. We're proceeding with the acute care tower at Richmond Hospital, and I'm looking forward to an announcement of that soon, but we're proceeding obviously with that project. In addition to that, with a new urgent and primary care center. In addition to that, investments in long-term care. In addition to that, building a primary care network and building on the announcement of a primary care network and the continued hiring of people in Richmond. So the people of Richmond in the healthcare budget were very significantly represented.
Member for Richmond North Centre, do you have a follow-up question?
Yes, please. Thank you, Mr. Chair. So the Premier came to Richmond Hospital on July the 2nd, 2020, and promised the Richmond community that he will be back in the fall of 2020 to confirm approval of the business plan so that the new hospital could move ahead. So we all know what happened in the fall of 2020. So we are now 8 months behind those days. So, and also my colleague MLA for Richmond, Stevenson, also said that there will be shovels in the ground in 2021. So now we are into 2021 and we are now 8 months behind those days. Why has the business plan failed to be approved in a timely manner? Thank you, Mr. Chair.
Minister.
Thank you very much, Honorable Chair. And I just want to say, as all members will know, what an important proposal this is for Richmond. A 9-story tower with an expanded podium, Honorable Speaker, 48,522 square meters in size. I think that's more square feet. 115 parking stalls. There will be 113 new inpatient beds added to Richmond Hospital, bringing the total to 353. That's a 47% increase, Honorable Chair. Emergencies department spaces are increasing from 60 to 82. The number of operating rooms will increase from 8 to 11. A fully equipped medical imaging department with 4 CT and 2 MRI machines, an intensive care unit, and a pharmacy. The new tower will obviously be built for earthquake safety and constructed above the floodplain. As well, mental health services will be relocated to the redeveloped South Tower and brought up to modern standards. And I think we understand that. I think I've said that to members as one of the most significant things that we can do as we build new acute care hospitals is bring our mental health services and those facilities up to modern standards, the standards that we would expect if it was our family member that needed to be in acute care for mental health or addictions reasons. New moms and their families will have access to an updated maternity ward and a neonatal intensive care unit also in the South Tower, Honorable Speaker. And as well, the redeveloped Illich Pavilion will be home to cancer care clinic, outpatient clinics, and the UBC School of Medicine Department of Psychiatry. It's going to be a fabulous project. We're going to be announcing the business plan soon. It's going to be fantastic for the people of Richmond. I myself have attended foundation events. They do a remarkable job. This project has brought people together in Richmond, and I just can't wait. I can't wait to the day when we break ground and build start physically building this new hospital. It's a great project. It's a commitment by the Premier, and it's my job to deliver on that commitment, and I am doing just that.
Member for Richmond North Centre, do you have a follow-up question?
Yes, please. Thank you, Mr. Chair. I agree with the Minister. This is a great project, and we are also excited about the expansion. But we know that the business plan was completed in November, so that means the new acute care tower is now nearly 8 months behind where we could be today. The Premier committed to completion in 2024 last July. Even the Mayor of Richmond, in a letter to the Premier, also copied to this Minister on May 31st this year. He said, I quote, "The project was first announced by the province in 2018 and was supported by an additional announcement in July 2020, which identified a more comprehensive plan for the project, including more patient rooms and additional amenities with a target completion date of 2024. So the Premier committed to completion date in 2024. Even the Mayor of Richmond also put it down in writing. And the Mayor was requesting a meeting with the 4 Richmond MLA in June. Unfortunately, my 3 other MLA could not make it in June. I don't know why. So can the Minister confirm here whether the Premier's commitment to have the acute care tower be completed in 2024 is still the completion date? Thank you, Mr. Chair.
Minister.
Honorable Chair, all I can say is that every other week I have the opportunity to meet with Richmond MLAs, and all they advocate for. Now, it's fair to say they were pleased with the announcement of a new urgent and primary care center in Richmond, which was necessary. They're delighted with the work we're doing with the primary care network, with the Richmond Division of Family Practice. They're proud of the work that we're doing in long-term care, increasing care standards and doing all that work for people in Richmond. But every couple of weeks, our Richmond MLAs call me and they say, well, I won't say how they address me, but they call me and they say, the Richmond Hospital, this is our top priority. We are delivering on this hospital and we're working together to see that delivered, and I'm proud of their advocacy and their work, as I am of the member for Richmond North Center. This is a community project in Richmond. It's going to make a difference for decades to come. And we're proceeding with the project. It's great news. The member is right that the initial plan was insufficient. We needed to do something bigger and better. And you know what? We're doing something bigger and better. And I can't wait. I can't wait for the day that's coming soon. We announce the business plan, and we just get on with this. We don't have political debates, that the advocacy of our Richmond MLAs will bear fruit in this announcement, moving forward, delivering on this project, which will make a difference for people in Richmond, and has already, I think, brought people together in Richmond. So I thank the member for her advocacy and her questions.
Member for Richmond North Center, do you have a follow-up question?
Yes, please, Mr. Chair. I can't wait either, Minister. And when the Minister says soon, how soon is the soon? So it's clear that the Premier's schedule is not achievable. The Minister hasn't really made any comment on my question, asking about the Premier's commitment to have the of 2024. On the other hand, we also now heard that the planned date for completion from Vancouver for coastal is 2027. So it's so confusing. I would like the Minister to confirm the date and that plans remain on schedule to complete it then either as the Premier's commitment on 2024 or the Vancouver coastal now telling us that it's 2027. Or will this be another missed timeline? Thank you, Mr. Chair.
Minister.
Thank you, Honourable Chair. I was just smiling to myself thinking about how proud I am of this hospital project and the work that's been done, the work that was done by the chair of Vancouver Coastal Health on this project, Dr. Penny Ballum, who said that the existing project, the concept plan that had been developed, wasn't sufficient and that we would do a bigger and a stronger plan. And proud I am of the Premier, who made this a centerpiece of his commitment on healthcare to British Columbians. We're going to deliver this project. I can't wait. The details, of course, will come of the business plan will come when we deliver the business plan. But I've delivered the basic details, the ones that matter to people, the services that we're adding. This is going to be an extraordinary thing for the people of Richmond. And the people of Richmond deserve it because they have been strong advocates of this hospital. And I'm glad that our Premier took a lead role in delivering this. And my job as Minister of Health now is to deliver on his vision.
Member for Richmond North Center.
Thank you, Mr. Chair. This is my final question because I don't seem to be able to get the Minister confirming whether the Premier's commitment to have the replacement tower completed in 2024 will be missed or not. There's no point for me to ask again. I won't get any confirmed date. But my final question is, over 50 million has been raised towards the project, and donors in Richmond are concerned. They are extremely concerned that progress has stalled. Some donation will undoubtedly be at risk. What does the Minister have to say to donors, to the more than 150 donors, individuals, families, business, community leaders who are waiting to see this project approved and funded? Thank you, Mr. Chair.
You know,
Minister.
Honourable Chair, you know what I say to donors to the Richmond Hospital Foundation, who I have met and worked with and stand side by side with? What I say to them is thank you for their commitment to this project, for the energy of their fundraising. I know Natalie Mixner, the CEO of the Richmond Hospital Foundation, very well. She does exceptional work. We're regularly in touch. We've met back when we used to meet. We used to meet in my constituency office, which is on Joy Street in Renfrew, Collingwood, for my constituents. And I look forward to meeting with Natalie again. I think what I'd say to all the contributors, and members and supporters of the Richmond Hospital Foundation who've attended events with me. I recall one particular one at the River Rock, which was just fantastic. And because I had to do 2 foundation events that night, I only got to eat the salad, but it was a lovely event indeed. I saw the community of Richmond. We met there. I am so appreciative of the people who contribute to the Richmond Hospital Foundation and all our hospital foundations. I think they are a public face of our collective commitment to public health care, and I'm very appreciative. So what do I say to the Richmond Hospital Foundation? Thank you. Look forward to seeing you soon.
Member for Kelowna Mission.
Thank you so much. So to the chair, through the chair, sorry, to the minister, I'm just going to ask again, where on the 10-year plan is the Richmond Tower?
Minister.
It's right in the 10-year plan.
Member.
Thank you so much, Chair. And which year is the starting of the Richmond Tower?
Minister.
Thank you very much. So what happens with capital planning in the capital planning process, which is not new to this government, but has been in place for some time, is that a concept plan is approved. In this case, a concept plan was approved. In this case, because there was such significant additions to that plan, the concept plan was amended and significantly expanded. And that announcement was made in July of 2020. That means it's in the 10-year capital plan. You can't announce a concept plan without it being in the plan. The money's there, it's in the 10-year plan. What happens next is the approval of a business plan. And the expression of that in the bureaucratic sense, and sometimes we debate about this, is that it will appear in projects over $50 million. Right? And that happens through the fiscal year. So as the quarterly reports are prepared by government, if there are new projects to be added above $50 million, you'll see that at that point. So those are the various parts of it. But the concept plan's approved, the expanded concept plan's approved, it's in the 10-year capital plan. We're proceeding, and there'll be more details when the business plan is released.
Member.
Thank you, Chair. So we're going to move on to the second Surrey Hospital at this point. And I would ask through the chair to the minister, could the minister define what net new means as the hospital is described in the fiscal plan on page 50?
Minister.
Well, thank you, Honourable Chair. And I think to go back to my previous answer, what that means is that the business plan's been approved, that the money's in the 3-year, is the projects over $50 million that have business plans approved, so you see it there, and that we're proceeding with the second hospital in Surrey, in Cloverdale. In addition to that, there'll be a new cancer center, and I won't repeat my lengthy exchange with the member for Kamloops South Thompson, except to say that what you see in a cancer center, in addition to a second hospital in Surrey, is in that case is what you kind of see at cancer centers in other places, including Victoria. So we have cancer services at Sir Memorial Hospital. We'll have a new cancer center, which we thought was an excellent plan. And what net new means is that it's not a replacement project, right? So we're doing a major and expanded project in Terrace at Mills Memorial Hospital, but that's a replacement project of an existing hospital, which people have been waiting for a long time, which we're proceeding with, which is unbelievably exciting for the people of Terrace. And in the case of Fort St. James, it's a replacement project. In the case of Surrey, there is no second hospital now, and so this is a kind of greenfield project. It will be on a site in Cloverdale, and that's what I think the member is referring to as net new.
Member.
Thank you, Chair. So in all of the other instances that the minister gave examples of, if it was, let's say, Kelowna, one that I'm very familiar with in terms of the cancer center being next to or adjacent to the hospital, but not integrated inside of the hospital. A cancer patient wouldn't walk through the hospital to receive services. They would go to the cancer center. I believe the same is similar in Victoria and Vancouver as well. But in the Surrey hospital example, it's actually integrated. Could the minister, through the chair, explain what an integrated hospital cancer center is?
Minister.
It means that the decision to build a second Surrey hospital, so needed given the growth in the city, so important for the life of the community, is an opportunity for British Columbia and for the Fraser Health Authority. Because we're building a new project, we can integrate the new cancer center fully into that hospital. In other words, it will be built at the same time and integrated into the hospital. The reason at Royal Jubilee they're separate is because Royal Jubilee had been in place a long time and then the cancer center was added after it. And that will be likely the case, for example, in Nanaimo, where we had the Nanaimo Regional General Hospital, we would add a cancer center. It would be a new project in its own right. Whereas in this case, we originally approved the concept plan for the second Surrey Hospital. Then we approved the concept plan for the cancer center and added it to the project because we thought that made sense. I mean, we're doing this extraordinary and unusual thing, which is to build a second and net new hospital in a community in BC's soon-to-be largest community and fastest growing community, and that this was an opportunity for us to expand needed cancer services in Fraser Health at that time. So that's what we mean by integrated. Frequently our cancer centers are naturally put on hospital sites, but this one will be built and integrated with other services at the hospital, which I think is a unique opportunity. Certainly people at Fraser Health felt that, and the Provincial Health Services Authority felt that this was a unique opportunity and we shouldn't miss it.
Member.
Thank you, Chair. And to the Minister, I absolutely agree. This is a great opportunity and will be a great resource for all of Surrey. So in the 1.66 billion that's attached to the Hospital Cancer Center integrated, how much is attached to the Cancer Center and how much of it is the hospital?
Minister.
Well, thank you very much, Honourable Chair. And I think one of the advantages of building them together is it's less expensive than building them separately. So there's an advantage in building them together. The largest cost is obviously the building of the hospital. And so that cost is well over, if you were to do it without a cancer center, it would have been well over $1 billion. And then the Cancer Center would probably add in the small hundreds of millions to do that. But we wouldn't carve it up in that way because, of course, we're building them together. And so, but that gives a sense of the quantum. The hospital is, and this is really in one-time span, the most expensive project in the history, to the direct treasury of the province, in the history of BC. The St. Paul's project is bigger, but that's a joint venture with Providence Healthcare, and so our contribution is not the full project. Although in that case, it's a $2.1 billion project, which is a substantial project as well. So these are legacies for the future, and I think the decision to go ahead with a cancer center was really the right decision. It's one I was very committed to, but the idea didn't come from me. It came in the concept planning process, and it came from PHSA and Fraser Health, who said, boy, this is an opportunity to do something we need to do. And it reflects, I think, the changing nature of Surrey. Surrey is BC's youngest community. It's, I think you could argue, its most dynamic community. Certainly, I think that. But it's changing. And over the next coming decades, it's going to transform into being more like the rest of British Columbia in terms of its age distribution. We're going to see the largest absolute increase in the number of seniors in Surrey. So it changes, the dynamic of a community and its needs change. And building this hospital together, and I think there is massive support in proceeding in this way in the community of Surrey, is the right thing to do. And adding the Cancer Center is really making a clear statement about the future and the future needs of the community.
Member.
Thank you, Chair. And I would agree with the minister that Surrey is one of the largest, it's one of the fastest growing, it's one of the most dynamic, and it is going to continue to age as a community and as a center. It also is a hub for the, for the city centers around it as well. So with that a comment in mind, through the chair to the minister, how was the determination for only 168 inpatient beds made for this particular hospital?
Minister.
Well, thank you very much, Honorable Speaker. And I don't know what to say about a world where a $1.6 billion project, and we use the term only. I've got to get used to that. I got to get used to that word. But what this is an integrated acute care system. So in Surrey, you have Surrey Memorial, which is obviously a massive hospital that provides many services, including cancer services, and will continue to provide cancer services into the future. And so a detailed planning process, and that's what concept planning is about, and in all cases, and business planning is about is what are the needs in terms of acute care beds in a community, and then other services. We know that over time, average length of stay in hospitals is reduced over time and has reduced significantly over decade unto decade in our healthcare system. So what are the needs? And the assessment, and so there's a detailed planning process that is led by the Fraser Health Authority in this case, and in other cases by the Vancouver Coastal Health Authority, that determines the need to increase beds. Sometimes that increase includes shelled beds, where you say we don't have it, but we might want to shell in some new beds. In other cases, it doesn't. In the case of St. Paul's Hospital, which has roughly 420 acute care beds now, the new hospital is going to be about 548. So net new, I guess that's 128, but it's, obviously it's a replacement of an old hospital with a new one. In this case, the determination on the number of beds was made in the detailed concept planning process by people who are specialists in this area against the needs in the community. But it also, on cancer care and other things, a lot of the care that's provided in those circumstances is day care, but is needed to be in hospital care. And increasingly, that's what hospitals do and move forward with. So that's what we're doing. That came out of the process. It's a very significant and increase and improvement in services in the Surrey community, in addition to obviously ongoing increases at Surrey Memorial Hospital. And I think this is what our health planners determined was the right size for this hospital at this time. But in addition to that, all the significant surgeries, services, including outpatient surgeries and services and cancer services.
Member.
Thank you, Chair. Just to take us down memory lane somewhat, when the Surrey Memorial expansion was announced almost a decade ago, that was for 151 beds, which was just an expansion, as you had mentioned, as the minister had mentioned. So again, with the fastest growing municipality, how was 168 beds, which is only 17 in addition to what the former addition was a decade ago, how is that deemed the essential number?
Minister?
Honourable, through a detailed planning process, and the services were determined in that process. Those include, for example, 55 treatment spaces to accommodate 78,000 emergency room visits a year. That's a detailed planning process over time that determines it. A medical imaging department that will offer mammogram, ultrasound, 3 CT scanners, 2 MRI machines, and pharmacy and laboratory and academic space and parking and dedicated space for spiritual care. And in terms of cancer care, 50 exam rooms, 54 chemotherapy treatment spaces, a capacity for 6 linear accelerators for radiation care, 2 PET CT scans, and on, right? Including, of course, the project will also include a daycare center on site. So that's a detailed planning process that said, here are our demands in terms of emergency care, in terms of outpatient surgery services, in terms of cancer services and others, and here's the hospital we need to build. That's why, and this is frustrating for people sometimes, we have such a detailed planning process and concept planning process so that we can go through that in detail and then deliver the care services we need. I'd say in addition to that, I'd say this as well, that we also need to expand long-term care centers, both to remediate and replace and renovate existing centers and add service centers and capacity in Surrey. And I think that's another significant opportunity for the people of Surrey. So this was what was rightly determined in the planning process. We, I think, rightly defer to experts in assessing future demands and what a hospital will look like and what services it does and how it integrates with existing services. And this project, which is, I think, going to be a remarkable project for the people of Surrey, is what emerged from that. And I think people are going to be really proud of it.
Member.
Thank you, Chair. Through the Chair to the Minister, what are the total existing inpatient beds currently in Surrey?
Minister.
Thank you, because I know that the member will be anxious to ask the next question. I would say that we added surge beds to hospitals in recent times, but we'll have that answer, I think, in 2 seconds. But the idea of having 2 hospitals in a community, we saw the improvements that are now finished at Langley Memorial Hospital, the addition of an MRI, the new emergency room, the new and changes at Peace Arch Hospital, Surrey Memorial Hospital, and the Second Surrey Hospital. And all of those things are obviously going to be integrated together, and they are by a health authority. And so that's determined in the process of, in the bed process. And so I'll just leave it. Perhaps the member can ask her next question, and we'll provide that on the answer that he's getting.
Member?
Thank you, Chair. There are two different dates for the completion of this hospital within the budget. There's one date of 2027 and another of 2028. Through the Chair to the Minister, could we identify which date we were thinking opening would be?
Members. Oh, Honorable Chair.
Minister.
Thank you, Honorable Chair. It's so good to see you. So good to see you. I got two numbers for the member. 629 is number one. That's the number of acute care beds at Surrey Memorial Hospital, and which is makes it a big hospital. You know, say bigger than St. Paul's will be. And secondly, 2027.
Member?
Thank you, Chair. So to the Chair, to the Minister through the Chair, will the equipment and staff be all new to this hospital, or will resources be reallocated from the existing Surrey Memorial Hospital or others within the Fraser Health Authority?
Minister?
Well, I think there's two ways to look at that. One, clearly, people move from hospital to hospital all the time, so they won't all be, we'll have many experienced staff people who will be leading this new hospital when it opens, and so they'll come from different places. But if you're supporting these beds and these and chemotherapy and very significant other services, you're going to require very significant net new staff, and that's our expectation and that's our intention. So it won't be that it'll be the same number of staff. It'll be the staff we need for Surrey Memorial now, plus the staff we need at the new hospital. But as individuals, they may come from different places across the country, around the world, but from British Columbia as well. We wouldn't have just newly trained staff there. We're going to have experienced staff from all over. But you have net new staff when you have a net new hospital.
Member?
Thank you, Mr. Chair. On September 23rd, the Premier said that the business plan was approved and that funding for the hospital is in the budget, and he also stated that construction would break ground by the end of 2021. Through the Chair to the Minister, will we be breaking ground in 2021?
Minister?
Well, the Premier was correct, and the budget that we're debating is a demonstration of that. The money is in the budget, and it's a very significant amount of money in a business plan approved by the government, and it's in the plan of the government. We're going through the next phase of it. Once the business plan is approved, is the request for proposal process, and then we begin construction. And we're off and running now. The project is on its way. It's going to be built between now and 2027 and opened in 2027.
Member?
Thank you, Mr. Chair. So through the Chair to the Minister, will we be breaking ground in 2021?
Minister. The chair is clearly putting his thoughts in my head. You know, the chair would prefer it if I was continuing to talk about the Richmond Hospital, but that's another story. He would love me just to not stop talking about that hospital. We're now in the process now to build a hospital. It's been approved. It's been approved by cabinet. The money's there. The budget's there, and we're proceeding. To go to contracting, and all of that stuff will be announced publicly. We'll have more information, even more detailed information about the business plan soon, and we're going ahead. It's fantastic news. We start from here. We've come a significant distance because there was no planning process for a second hospital in Surrey. And so we started the concept planning process in December 2021. We announced an approved concept plan in December of 2019, I believe. We approved the business plan, and it's in this budget in April 2021, and now we proceed. The next stage, to say the member, is the request for proposal in the tendering stage, and that's what we're entering in now.
Member.
Okay. Thank you so much, Mr. Chair. So I want to go back to the Surrey Cancer Centre. I know that you had provided a list of services that were to be in most cancer centres as well as included in this one. I just wanted to ask about a couple of other things. What about genetic counseling? Is that on the list as well? Is palliative care or hospice support? What about psychiatry?
Minister.
Thank you very much, Honourable Chair. And as you work through in the coming years, service design work, the details of services delivered in a specific sense will come at that point. But all of the services you'd expect in a hospital of this type, the New Surrey Hospital and Cancer Centre, you'll see there in terms of cancer care services. Those include an oncology ambulatory care unit, chemotherapy, radiation therapy, functional imaging, including PET and CT, cyclotron, and space for 6 linear accelerators. So that's some of the planning process. There will obviously be mental health services provided as well, and significant numbers of inpatient beds. So this hospital is going to help meet the needs of the community, along with what goes on and all that goes on at the very significant Surrey Memorial Hospital. And so what I would expect as we go through service planning, because all those services need to be provided now in the existing healthcare facilities, that what we've created is a hospital where many of these things can happen, and on some of it, for example, the need for space for chemotherapy or other issues, that's specifically planned out. The rest of it, though, we would expect cancer care to be similar to other cancer centres around BC. So the detailed service planning around a hospital is a key part of the planning, the capital planning, but the detailed service planning will happen closer to the date of the opening, but there'll be more information about that as we release, as we provide more information as we go forward through the competitive bid process. But we're building the hospital now. The services will come when it opens.
Member.
Thank you, Mr. Chair. When will the service planning be completed?
Minister.
So concurrent with the hospital being built in this case, there'll be a consultation process as everyone would expect that would involve the community, that would involve First Nations and so on. And the basic structure and what we're doing there is inherent in what we're building, right? A cancer center, a hospital with X number of beds, and then we'll be working with the community in terms of service planning, and that involvement is also occurring in hospital projects and the many hospital projects. And given the hour, I won't list them all now around BC, but as you know, a lot of that planning services will do and how you'll change services has involved, especially I would argue, well, in all the hospitals in BC, because Surrey, you can make an argument, is BC's largest Indigenous community with the largest number of Indigenous people living in Surrey. Vancouver is very significant, and there are Indigenous communities around BC. But in our planning, and as we build out, for example, Caribou Memorial Hospital, there's significant involvement of First Nations, Silcotin First Nations and others in that process, the Williams Lake First Nation and others. So that process is going to happen over the period and concurrent with the bids and proceeding with the project that's occurring over the next few years.
Member.
Thank you, Chair. And that will allow us to move maybe a little bit into a higher level discussion about cancer care. I'm going to quote you from last week I'm going to quote the minister from last week in seniors estimates. And I quote, "I think we have to prepare for a moment. We talk about this and we'll talk about it next week when we talk about cancer." That's right now. When 50% more people will have cancer by 2035. It's not because we're not doing a good job with cancer care in general. It's because there's going to be more age-related cancer and outcomes are going to be better. That creates a problem that we haven't had in human history before, end quote. Through the chair to the minister, do we have a 10-year BC cancer plan?
Minister.
Thank you very much, Honorable Chair. And what we've had is a significant increase in spending over the last number of years compared to what it had been before. And obviously increases in services, some of those focused on prevention, some of those focused on surgery. I think what we need, given the future that I was describing, is a 10-year cancer plan, which we're preparing and will release publicly soon, that will lay out the roadmap for the next 10 years. Now, I was referring, I think, to 2035, so that's obviously beyond the time of the plan, but what I was suggesting is that we've got 3 sets of issues. One is a good one, that the cancer services we're providing are improving, and the healthcare from a treatment perspective is improving and becoming more expensive. And one of the primary ways it's becoming more expensive in cancer care is the almost exponential increase in the price of cancer drugs, for example. And how you marry that and meet that with prevention, which is critically important, living with cancer, and other care is and will cancer drug costs crowd out the full other aspects of the plan, as they sometimes do. So that's why you need a plan that addresses issues such as capital, such as the one I was discussing with the member for Kamloops earlier, but others as well. What is the capital requirement? Can we provide more and better services around the province, given that there may be greater concentrations of people with cancer, given the increase in numbers of people with cancer around the province? Ensure that we meet the actual demand and the growing demand for cancer services and in the province. And also, and I think this was an important part of the debate I had with the leader of the opposition on seniors care, increasing the quality of life of people living with cancer. And I don't think there's a family, certainly my family is not immune from this right now, who doesn't have beloved family members living with cancer. And we have to make sure that we deliver when many people are living with cancer as a chronic disease or living with cancer for years and years and years, that we have services that support them in that, while at the same time being able to develop and meet the technology needs of the future. So I would say, one, we've got improving treatments, but they cost money. We need to prepare for that and be on the cutting edge of that. And I think some people think that BC was 20, 25 years ago, 15 years ago, at the cutting edge, like, at different points. And this is not a political comment. This is us, right? I don't mean it, and I want to be clear, I don't mean it in any way that way. That there was a time when we were world leaders, and we need to do that. And I like being world leaders, but I also like to provide care to people, right? Real people who often need the core services that an agency provides. So we need to be on the cutting edge. We need to have, in terms of research and development and treatment and technology, and provide better care. We need to provide supports for a larger group of people who are going to be living with cancer, including age-related cancer. We got to bring cancer care closer to home, and that means more cancer centers and more communities. And the technology may invite us to do this more effectively in future as well. Hopefully these cancer centers, well, they'll look like the Victoria Cancer Centers, will be better than that, and that may not mean the same footprint and everything else. And that we do prevention. And one of the aspects of that we have implemented and that we've launched and will be implemented, I think, in March 2022 is lung cancer screening, which is when you ask people in cancer care, what's the way to save the most lives and provide the best prevention and early intervention, which can be the most effective. And how would you save the most people? Well, it's lung cancer screening, which sometimes historically I think has been not viewed as much of a priority because of the inevitable linking of lung cancer to smoking, but which is really important. And so I'm very proud. I think that's a great idea. I advocated for colorectal cancer screening, and Premier Campbell announced it. Right? He was an opposition health critic, and I advocated for that for years. I'm so proud of it that I put it in my biography. So there you go. And so I think all of those elements have to come together. Prevention, the delivery of services, of course intervention, and how we deal with the growing population. And that's why I think having a 10-year plan that gives our researchers and our clinical staff and our health human resources side and people and screening a plan that takes us through this next 10 years and has BC leading the country and the world is a good idea, and that's what we've asked the Cancer Agency to develop, and we have some sense of it now, and we've talked about what that sense is, and I think I've described the elements of it. But, and I look forward to announcing it soon, and then just doing the work. And hopefully, if it's a good plan, and I think it will be, driven by the science and driven by the clinical, by people both living with cancer, but also the clinicians, then it's something that governments will pursue over a 10-year period.
Member.
Thank you, Mr. Chair. And I agree with the Minister that truly a 10-year cancer plan would be a legacy for the Minister and for British Columbians. And I would also agree with the Minister that we have a cancer tsunami coming. In looking at some of the numbers and even some of the early intervention measures that we are talking about with COVID having been a factor over the course of the last 15, 16 months, I wonder how many cancer patients went undetected and how that will be affecting us in just the next couple of years. But I'll go back to my original question, and because we've referenced having a 10-year plan, and it's coming soon, knowing all of the work and effort that it takes to actually develop a 10-year cancer plan, is there one in the works? Is there one that's already been presented at this point to the Minister?
Minister.
Yes, and inevitably, Honourable Chair, you know, I think it's the idea that an answer would just be yes. It's just impossible to consider. But interestingly, more laughs on this side of it. They spend some time with me, Dr. Brown and Mr. Pokorny. But the answer is yes. I mean, obviously, you're doing drafts and drafts and drafts of this, and it's being directed by the Provincial Health Services Authority and the Ministry of Health. But it involves every health authority, because even though the BC Cancer Agency delivers cancer services, they do so, a huge amount of the work is actually done in health authorities, in primary care and everything else. So it's not just, it's led by the PHSA, but and if the PHSA is listening, I know how well everybody works together in the health authorities all the time, that it would involve all the health authorities, right? So that's the process. So yes, of course, there are drafts and direction and so on, and they're working their way through that because it comes forward, and then we work on it, and we want to make sure we get it right. And then obviously there's funding questions and other questions, but principally I think, of course, we've seen drafts of it and discussed what should be in it, and some of it is what we've described and what the member just said was, okay, how do we deal with what's coming, the good, people are living with cancer for a long time, and the challenging, which is people are living with cancer for a long time, and how we deal with that over the next number of years. So that work is being led by the BC Cancer Agency, but there are literally a cast of thousands involved.
Member.
Excellent, thank you, Chair. And that is such great news. I wanted to do a little cheer, but for Hansard, I was cheering while the minister was talking about a 10-year cancer plan, because I am concerned. I am concerned that not enough planning has been done, and that, as we have seen, the first announcements about the second Surrey Hospital came, 2017, and it won't be completed till 2027. So we know how long some of these measures take. So my next question through the chair to the minister is, where is the cancer plan currently in the fiscal plan? Is there any money budgeted based on that cancer plan?
Minister.
Thank you very much, Honourable Chair. And yeah, we've seen very significant increases in expenditures of the BC Cancer Agency and on cancer around British Columbia. A significant lift over what it had been, as we have across the healthcare system. It's not surprising. The overall lifts have been larger. So the lifts for cancer and the demand for cancer, particularly the significant inflation in cancer drug programs, is there. So, in some early stages of it, for example, where we've made decisions and we're proceeding, for example, lung cancer screening are there, and that will obviously become one of the screening programs that's part of the plan, but so will colorectal cancer and other areas. So what you're going to see when we announce it is also an announcement around costs, and that will happen and happens in the process when we announce the plan, and I expect to see the plan soon. There will be operational costs, and there will be over time capital costs, and the capital costs will go through their own process. In the case of the Cancer Centre in Surrey, it's gone through fully that process of business plan approval, and then it's integrated into the larger $1.6 billion hospital project. In other cases, they would go through their own business plan and be approved. So that's the process we're going through, and I look forward to presenting the plan. And you can't present a plan in full in government without, this is not an academic paper. You got to present a plan that has, part of that plan has to be the delivering of resources to support that plan. And it wouldn't be necessarily delivering of resources over 10 years, right? Because those resources would happen, but you would definitely be looking at the early years of the plan and saying we're doing this, this, and this, and then adjustments will be made along the road, and you'll do more. But the plan will be presented in full when it's ready to be presented, and obviously the financial question will be a key part of that. And I look forward. It sounds like the member will look forward to that briefing as well.
Member.
Thank you, Chair. So according to the BC Cancer Agency website, they actually report on 5 main areas: new diagnoses, incident rates, mortality rates, survival rates, and then statistics on cancer types. Is there a reporting body that reports out on wait times? And I know that there's some information on wait times on one of the government websites, but it doesn't specify what group monitors it or collects it. So to the Chair, to the Minister through the Chair, is there a reporting body that reports out on wait times?
Minister.
Thank you very much, Honourable Chair. BC Cancer reports on wait times, as do health authorities in general. They would be the ones reporting on wait times. I think the issue of wait times is always a challenging one because it's generally done in the public reporting from day the surgery is booked to the surgery, for example, if it's for surgery, maybe for other procedures, and that's the way it's been done historically in BC, and that's the way we do it. But with respect to cancer, BC Cancer reports on wait times through the Ministry of Health.
Member.
Thank you, Mr. Chair. So would through the chair to the minister, would the minister commit to reporting on cancer, wait times, and cancer outcomes?
Minister.
I think one of the key elements of a 10-year plan, just as one of the elements of we were talking about emergency health services earlier is response times, and that's one of the elements of that plan, and there would be other elements. One of the elements of this plan, and the reason we think we need a 10-year cancer plan, is that we see this growing demand for cancer. And so one of the elements of such a plan is, well, how do you measure the success of the plan? And so a regular reporting. And similarly, we know we did the surgery renewal commitment, report on that every week. We do monthly reports on that every month. And I would expect a similar process to be in place, not just sort of annually or regularly, but a regular process of reporting on the cancer plan is something that would be a key part of it, and that means all of the elements of that plan. So how we're doing the capital side, how we're doing on surgeries, how we're doing on other interventions, how we're doing on diagnosis. And so I would expect that to be a significant part of the reporting on a 10-year cancer plan. It is whenever I do a plan, that's what I like to do. But I don't think it's unusual to me.
Member.
Thank you, Mr. Chair. So I think that the wait times that you were referencing before were actually related to cancer surgeries, but I'm not entirely sure. But if the minister or any of the ministers could staff could respond to how do we compare to other jurisdictions in our outcomes for cancer?
Minister.
Thank you, Honorable Chair. It's still very good to see you there. What we can do is we have health information units in the Ministry of Health, and generally speaking, the interprovincial comparisons are sometimes produced by CIHI, which is the Canadian Institute for Health Information, and other national bodies, and other people do comparisons of wait times. So what we can do is do a review of those interprovincial comparisons and share that with the honourable member. We get them from time to time, and I'm sure we can produce that and send some to the honourable member in the coming few days.
Member.
Thank you, Mr. Chair. So luckily, I've already done that with the Canadian Institute for Health Information. So I will just let the minister know, and if the minister would like to provide that information for me as well, that would be fine too. But what I could say is that our radiation treatment wait times in terms of percentage have actually been slipping year over year since 2017. And they are dramatically off what the Canadian average is. And in fact, Quebec in 2017 had a 98%, and ours was hovering at about 93. Ours today is just over 91, and Quebec and Ontario are both at 98%. And the national average is actually at 97. So BC, it doesn't just trail, we're actually one of the almost lowest in terms of where we rank with the rest of Canada. So looking at the data, it seems that not only is BC low, but we've also seen a steady decrease in our outcomes and worsening of wait times over the course of the last 3 years. And just for those that might be reading Hansard, the lower the percentage, actually, the worse that you are on this particular outcome. So what would that be particularly attributed to, would be my first question. And the second, through the chair, to the minister, is what is the plan to solve it?
Minister.
Thank you, Honourable Chair. And with that particular indicator, and as the member will know, there are indicators where we've gone from last to second. So I look forward to that discussion. I look forward to sending you those, right? In that case, what it shows is that we're below the national average, and we're still below the national average. And it says to me that we have to improve that.
Member. Thank you, Madam Chair. Welcome. So through the chair to the minister, how are we going to actually solve that issue?
Minister.
As the member will know, these issues emerge over time. Part of it is an investment of money. And so when you double the increase for the BC Cancer Agency that had occurred prior to 2017, you start to address that, see increasing demand. So it's in part through investment. It's through a health human resources plan. And in the case of this government, the significant investments that have been made in cancer care in particular, the improvement of services in different regions, including the region represented by the honourable member, all of those are the ways that you address that problem. Applying resources, innovating in the system, the change when the member talks about a dramatic drop. We were in that measure that she's referring to, which I think comes from this week's Sky High, perhaps that one is, and shows some measures where we've gone up. That particular measure for the past year was, I think, measured through the time of pandemic. Ontario and Quebec were above us in 2017. They're above us now. And the idea is for us to do better on that measure. There are some measures, as the member will know, because she's read the report, which are demonstrate the efforts we've made in British Columbia to improve relative to other provinces. And I don't talk about those that much, although I look forward to doing it sometimes. But I would say that when you look at other important measures in our healthcare system, particularly on the diagnostic side, the comparison before 2017 and now is dramatic. In this case, we were near the bottom then, and we're near the bottom now, and that means we have to do better.
Member.
Thank you so much, Madam Chair. So with all due respect to the minister, in 2015, we were actually at 93%, whereas today we're at 91%, whereas the national average back in 2015 was 98%, and in 2020 is actually 98% as well. So in actual fact, we were doing better in 2015 than we are doing today. And I'll reiterate that we've had a steady decline in our percentage. We've had a steady decline in our outcomes for this particular wait time. So through the chair to the minister, in the budget, we have $300 million that is funding, that's over 3 years, that was announced to support MSP, pharmacare, and cancer care. How much of this is allocated to cancer care?
Minister.
Just for people watching at home, the 2018 numbers that were produced on this thing were based on previous years. So we were 10th of 10 provinces when I became Minister of Health. and we're still on the measure the member talks about, 10th of 10 provinces. So that's what we inherited, 10th of 10, and we got to make it better. I agree with the honourable member. With respect to the budget for this year, the number is 65 for cancer is a 7.2% increase in the budget of the BC Cancer Program, which is $65.8 million.
Member.
Thank you so much, Madam Chair. So 10th of 10th in 2018, 10th of 10th in 2020. I would have to go back to see where we ranked in 2015, but what I can say is that we've gone steadily down. So despite still being 10th of 10th, we're going down in what our actual outcomes are. And we are significantly down from 2015 to 2020. But the jousting match, I can let go for this particular moment. So my follow-up to that last one is through the chair to the minister. Is there an expected increase in cancer medication over the next 3 years, as the 300 million or the 65.8 million is allocated as a 3-year amount?
Minister.
So, like the pharmacare budget, the cancer drug budget is increasing substantially. So it's just to get the net drug change, which includes a reduction in cost due to the biosimilar project program, which also deals with cancer drugs. So if you look at the net change in percentage costs of cancer drugs, the years go as follows. 5% 2015, 16, 6%, 16, 17, 13%, 17, 18, 9%, 18, 19, 13%, 19, 20. So over those 5 years, if you take them together, that's an annualized 10.4% average. That includes significant negotiated rebates and so on that we do. So you get a sense of what the annual increase is. If you took away all of that, it would be in the nature of 17%. And by the way, on that measure, on the cancer drug measure, those increases, we talk about what it was before, and those are really defined by the cost of the drug. So it's kind of a needs budget that you got to manage within those needs. Those would go year onto year. I think in the previous estimates, I talked about the net during that period, but that's what we're talking about. We're talking about double-digit increases going back a decade. And what it reflects, I think, for policymakers and for myself as minister, is a little bit of what we can expect for expensive drugs for rare diseases in other areas. So it's, with respect to expensive drugs for rare diseases, in my view, the cancer drugs, which are that kind of drug, are kind of a canary in the coal mine of the demand for expensive drugs for rare diseases. It's why British Columbia is led in those files, because there's a lot of people talking about national pharmacare, and I hope it happens, and I'm there for it, and I'll be there for it. They have a meeting on Boxing Day. I'll be there for it. I'll be there for it on July 1st. I'll be there for it on any day if they want to have a meeting on national pharmacare. What I'm committed to, though, is driving the federal government to take a bigger role on expensive drugs for rare diseases, because and you see that in cancer care. So what we've seen in cancer care over the last decade, we're going to see in that category of drugs over the next 10 years. And so that's a consideration for everybody.
Member.
Thank you so much, Madam Chair. So I want to go back to something that I asked for earlier, just to make sure that I heard correctly, and that is through the chair to the minister, that I believe I heard a commitment to actually reporting out on cancer surgery, cancer wait times, and then cancer outcomes. I just wanted to clarify and make sure.
Minister.
That's right. That reporting out will be a key part of the plan that we put together. So regular systematic reporting out, just as we've done on the surgery renewal plan, where our teams put out month to month a report on surgeries we've done, types of surgeries we've done, the impact of those surgeries. And that, I think, has been exceptionally successful when a plan is working, such as that plan. It builds momentum and a sense of support for the plan, not just in the public, but amongst all those participating. So I think when you're involved in a large system, people like to see themselves doing well and performing well. And so I think that's a good model, and that's the model that we intend to put in place with the cancer plan.
Member.
Thank you so much, Chair. And I agree with the minister. I love when we take a document and a plan and then can measure against it and change it as necessary as we see things change. Back in 2015, 2016, we started seeing predictions that cancer incidence in British Columbia is expected to grow by 57%. The BC Cancer Service started to really talk about this back in 2018 and make some very fierce predictions and some strong predictions. We're seeing that our wait times are slipping, and that we're actually, I can only imagine that's due to having more people, because as the minister has talked about, there's been additional supplies or additional supports and infrastructure in 2012, and the minister has identified how MRIs have increased, et cetera, in the course of us talking through some of the other aspects of digital technology, as well as radiology, as well as surgical wait times. So what is the current commitment? And this I'll talk about those that are already there, and that is our oncologists. What's our current commitment to them, to the ones that are working way too many hours with a lot of patients and really bearing the brunt of this onslaught and of this incredible tsunami of cancer? And I'll start there with that question.
Minister.
Honorable Chair, I just say with respect to the KAI report, it was 2016, we were 10th of 10 as well. And this isn't, we were there. We want to do better. We want to do better. And so my point wasn't that. It's essentially the same result now as it was then. I don't, by the way, I don't want the member to think for a minute that I don't have expectations to do better. Right, so whether it's the same result as then, it's not a good result in that area. We've had very significant improvements against other provinces on other measures, and we've got to do that there. We've got to do that together. What's our commitment? The very significant increases. I think it was the 2018-19 budget, the $105 million investment in increased services. So the money we've put forward, the money we're putting forward, and to train and develop more oncologists, which we're going to need. But also as well, because it's not just our oncologists, but it's people throughout the cancer system, our technicians, our health sciences professionals, our nurses, our care aides. I can tell you that, and this isn't just at the BC Cancer Agency, which is receiving and has received significant budget lifts over the last number of years, but in our health authorities, it's why we need to build out a new and help support a new generation of healthcare professionals and healthcare workers as well. But providing resources is one thing we need to do, and that's why we've increased those resources to cancer, why we've added new screening programs, and why we're going to continue to do that work together by following their path. And finally, I think, by continuing to invest in research and continuing to make the BC Cancer Agency what it has been and what it should be. There was a lot of, and has been, a fair amount of disruption. If you go back through the last period leading into when I became Minister of Health, it was there was a lot of there had been a lot of interaction and negativity around the cancer agency, and I think the leadership of the agency broadly, and I mean hundreds of people, has done a really good job under a lot of pressure, because the increase in the caseload, the fact that elderly people move from other jurisdictions to here, right? So people will live their whole lives in the province of Alberta, and a very large number of them move to British Columbia in a time when they would be most likely to get age-related cancer. And there's some movement in the other direction, but I don't think speaking to the member for Kelowna, I think there are as many people moving from Kelowna to Calgary as there are from Calgary to Kelowna. I think that's a fair description. I won't discuss why that's the case. So that's the challenge in BC. People are moving here as well, and people move here to retire, and that presents itself, and it always has presented more, but I think even more so now, challenges to age-related cancer. So the commitment to oncologists, we're going to is their involvement in the development of a 10-year cancer plan. Our commitment is our need to train more oncologists. Our commitment is our need to support them. And that's at least in part reflected by the budget increases that I've been proud to present to the legislature for the last few years.
Member.
Thank you so much, Madam Chair. So we have had an incredible increase in caseload, as just recognized by the minister. We've got a 57% increase in cancer incidence, and we actually have estimated new cancer diagnoses that are exceptional over the course of the next years, and that doesn't even take us to 2034 or 2035 as that report did. I asked specifically about oncologists, but I do appreciate the minister increasing the scope to also include nurses and care aides and radiation techs and therapists. And what I would ask again is, through the chair to the minister, what is the current recruitment and retention strategy for these positions? How many new positions is included in this current budget that we see before us?
Minister.
The Deputy Minister is not going to get a 10-minute break. Because apparently I'm told by you, Honourable Chair, that it's 5:50. So that means only 3 to 4 hours to go. Today, you know, it's our ratings go up, Honourable Chair, when we do this in prime time. I don't know if people understand that they do that opposite Wheel of Fortune. We'll get the specifics on the numbers. As we've discussed before, there's this also a significant health human resources plan, because this is not just an issue in BC Cancer, it's an issue of BC Transplant, it's an issue across health authorities and across the health system. But what we'll do is sort of give, I think what the Deputy Minister is getting is year-to-year numbers, and if we don't have them, then what I'll do is I'll get them for the member before we begin again tomorrow morning at 11 a.m. precisely, or more or less.
Member.
Thank you, Madam Chair. So I thank the Minister for his perseverance throughout all of these questions, etc. It is a lot, and it's intense, and I, being new, I'm sure he wishes it was someone else, but that's okay. It's been very, very good, so I much appreciate it. In looking at the budget and in acknowledging that we see inflationary increases and percentages year over year, and obviously the largest percentage of increase is pharmacare, but that doesn't address our increases and our I guess being behind with two different aspects of the cancer plan at this point. And I'm not talking about the general 10-year cancer plan, because I'm not aware of that. But it's twofold. One is the human resource capacity. And I'm asking questions about recruitment, retention of different aspects of the BC cancer area. But then the second one is actually the infrastructure. We've got the Surrey Cancer Clinic that's going to open in 2027. Very excited to hear it's 2027 instead of 2028. But that puts us almost at a huge gap between any amount of infrastructure increase. How are we, and this is the question through the chair to the minister, how are we going to survive knowing that, I mean, I don't want to sound alarmist, but I will sound the alarm, which is how are we going to survive until 2027 when the first aspect of infrastructure increase will actually come on stream? Minister.
Well, Honourable Chair, first of all, it's not just Surrey. Burnaby is doing the same thing. So there'll be 2 in the Fraser Health Authority, which is represents 38% of people in BC and a growing number of seniors. So those are 2 significant facilities. But it's not just cancer centres. I think if I were to say to the member, well, you haven't created a cancer centre in a few years, and therefore there is an increase in capacity. There are very significant things one can do as an interim to that. It's not just the building of hospitals that is necessary. A lot of the best cancer treatment is primary care and the supports for primary care. And so the centres give us new capacity for chemotherapy and radiation, but we can also increase that capacity in existing centres. And you've seen that with diagnostics as well, most recently in Kelowna and Victoria, which was real changes that were on the capital side paid for by fundraising, by the way, but on the operating side, which is the biggest cost, let's face it, is paid for by the public healthcare system. So those kind of improvements we have to continue to make. So I don't think we're waiting until 2027. It would be great to have that centre, great to have Burnaby open, great to have Kamloops open, it'll be great to have Nanaimo open. But there are a lot of people who will be serving in the interim and continuing to provide better and more efficient services. That will be required year into year, including in some of those communities, because some of those communities will need services before that. And so it isn't just we wait until we build a big centre. With these significant year-into-year increases in a 10-year plan, the capital will be one portion of that plan. But I would argue it's all significant, so I'm not going to compare its significance, but there are other equally or more significant parts of a cancer plan in terms of increasing the capacity of the system to respond.
Member.
Thank you, Madam Chair. So I'll agree with the minister that there are other things that we can do. And that is what I'm asking for in terms of what are we going to do until 2028, specifically related to our human resources. Because as many MRIs or as many surgery and OR time as we increase, what are we going to do? What is our plan? And through the chair to the minister, what's our plan to recruit human resources to cancer? How many new specialists are required to simply stave off this tsunami?
Minister.
Thank you, Honorable Chair. In 2018, and with surgery and with primary care, and then when we launched the surgical renewal plan, and I'm not going to, I'll spare the member the repetition of the extraordinary human resource aspect of that plan, which saw medical processing technologists and surgeons and nurses and health sciences professionals and healthcare workers added to the system and recruited in the system. And it's been an exceptional success. On primary care, equally, human resources are a key element of our primary care plan. The urgent and primary care centers, hundreds of healthcare professionals and workers working there. Our primary care networks adding and building out the team in primary care. And there'll be, I'm sure, an occasion before we finish the estimates to talk about that. So when you're talking about a 10-year cancer plan, human resources are a key aspect of that. And they have been, obviously, we'll get the numbers. There's obviously more people as we build out the BC cancer budget in recent years that reflects it there. But I would argue that will be the human resources part of it is equal or greater importance than the capital aspect of it. There'll be lots of debate between my friend from Kamloops South and people in Nanaimo and everyone else in Surrey and Burnaby about those projects. But the human resource plan, which will get less debate and less profile, is equally or more important.
Member.
Thank you, Chair. So through the chair to the minister, would the minister commit to publishing a cancer surgery report wait time card by hospital in BC before the BC Cancer 10-year plan is released?
Minister.
Thank you. Well, I think the purpose of reporting out is to provide benchmarks, so I'd expect to be providing benchmarks. Those are the things that you can judge against in terms of outcomes. And clearly, as we pursue surgical renewal, cancer surgery is very important because frequently, it depends on the surgery, of course. You're talking about surgery wait times that are not within months, but within weeks, right? And so that's an important consideration. So that would absolutely be part of it. So part of what you'd want to establish is, well, where are we now? Not just in wait times for surgery, which is necessary and occurs, and people do a very good job, just as they do in cardiac and other areas. But wait times for radiation, for diagnosis, and others. Those are the building blocks, I think, of a plan. Well, to say where are we, where do we want to be, and to judge the importance of addressing wait times there against the importance of other considerations, including prevention and supports in communities, right? Because you don't want. I think this is the issue with cancer drugs frequently. Is to ask ourselves the value of that expenditure of cancer drugs compared to other things. And that's why you need a plan, it seems to me, to say, well, we need to do drugs, but we also need to do health human resources, and we need to have targets for wait times. And I think the key wait times that are of greatest concern are not just surgery wait times, which British Columbia and I think other jurisdictions do reasonably well on. It's the important questions around diagnosis and waits for radiation and other things. So I would expect those benchmarks to be part of the plan. And you have to, if you're going to lay out a plan, you have to start from somewhere. You have to say, well, we started here. This is where we are. This is where we're going, and then be able to measure that year into year and against the obvious and expected growth in cancer patients.
Member.
Thank you, Chair. And so I'm going to agree with the minister. I think it would be excellent to be able to establish these benchmarks and to be able to measure the 10-year cancer plan against them. So through the chair to the minister, would the minister agree and commit to establishing these benchmarks this year, but even before the 10-year cancer plan is released?
Minister.
Thank you, Honorable Chair. I think a significant portion of this information is publicly available. I'm happy to share it, but I think it will be important when we lay out the 10-year plan to provide those benchmarks and to say, well, this is where we are. This may be adequate in some areas, and we just need to maintain, which is no small feat when the numbers are going up on the one hand, and these are areas where we need to improve from BC's historic position or where we are now.
Member.
Thank you, Chair. So does the minister have the oncology numbers in terms of current recruitment, retention strategy for oncologists, radiation techs and therapists, nurses, and care aides, in terms of how many are required, as well as what the plan is to recruit human resources over the course of the next year?
Minister.
I think this is the same question that we were looking for before, but I'll obviously we see the very significant investment in health human resources in both reflected a little bit in my budget and a lot in the budget of the Minister of Advanced Education, Technology and Training. So we see that. I'd be happy to share. I think we're going to share some more information on those seats and that training. There's an ongoing effort, ongoing recruitment across the healthcare system, which has been going on and as we've seen reflected in seniors and in surgery and in primary care, and we'll see reflected in cancer as well. And then there's the health human resources portion of both the cancer-related portion of the health human resources plan, which will be integrated with the 10-year cancer plan, which will have a significant human resource component.
Member.
Thank you, Chair. Through the chair to the minister, what is the plan right now to help with the oncologists currently this year, to help them with the current workload with respect to cancer patients?
Minister.
Thank you very much, Honorable Chair, and very good to see you there as well. Thank you. And as we've laid out and presented, I think I said to the member we'll get information on both training seats, but also on the increases in various disciplines within BC Cancer, and we'll try and share that by tomorrow, so she'll have a chance to follow up on that. I think that's what she's asking for. There's a very significant, I'd say, competition for specialty healthcare. One of the advantages we have in British Columbia is we're at British Columbia, and it's a beautiful place to live. People want to stay here. We're building some of the most modern and extraordinary hospitals in the country. We're adding research capacity in healthcare, and we're recruiting people to our agency. So there is an ongoing and considerable recruitment effort across health authorities, and we'll share some of the information from BC Cancer. They're going to share it with us, and I'll share it with the honourable member. And so this is work we're doing all the time. But as I've said to her, we also have to take a long-term view of it. There's adding positions, and obviously when you increase the budget for BC Cancer, as we have again and then again and then again and then again. There are more people working there, and that requires recruitment. There's also replacing the people who are retiring and moving on. So that's an ongoing and high priority effort in healthcare in general and here in British Columbia. And I'm, as I committed to the previous question, I'm happy to share the details of how we've been doing with the honourable member.
Member.
Thank you so much. And I appreciate the minister's comments. I hope that the minister sees that I am attempting to advocate for those that are on the front lines and attempt to, again, back to the original comments at the beginning of these estimates, was to bring hope and to bring a message of what planning is being done on a move forward basis. As we know, the pandemic has been a light, and the light that's shone through the cracks. And unfortunately, or fortunately, there has been a spotlight on healthcare, a spotlight on our front line and our frontline workers. And it also has shown us just the cracks in our legislation and in our planning and in our programs. And if we choose to simply ignore this light and just hope it'll go away eventually and the cracks won't be as noticeable, well, then we're just doomed as a society to repeat it. I love the words of Dr. Tam, and I won't quote her directly, but recently on a webinar that I watched, she urged all governments to take the opportunities and the revelations of the pandemic and make sure that we learn from them, to make sure that our sacrifice is not wasted as a society. And I think that there is no greater area that has suffered than watching some of our racial minorities suffer through this pandemic, as well as our front lines. And I understand that all mandate letters, and this I will quote, have urged a moral and ethical responsibility to take racism and discrimination in all forms. My question through the chair to the minister, to start off a little bit of a different twist on the healthcare and front lines, is what are the specific funds that are dedicated to this end within healthcare and within this minister's mandate to reduce racism and discrimination in healthcare?
Minister.
Thank you very much, Honourable Chair, and I agree with the member that some of the most important things we need to do are to address issues of racism in society and to address issues of racism in healthcare. We can't heal in a system that is not safe for people. And I'll just give an example to the honourable member. We did a report called In Plain Sight that was delivered by Mary Ellen Turpel-Lafont, and I'll have more to say about that in a moment, that identified Indigenous people as 11 times more likely to leave against the advice of their physician, one of the most prominent and highly respected healthcare institutions in all of BC, than the average woman in that case. And one of the things we did in the middle of the pandemic, faced with concerns about racism in the system, was launch the In Plain Sight report. And Mary Ellen Turpel-Lafont, who in my view is an extraordinary person, an extraordinary British Columbian, agreed to do the report in June of 2020. By November 30th, when she released the report, and when you look at other reports that have been done, and the quality of the report, both from the point of view of data and the point of view of involvement of people and the point of view of the quality of the recommendations, that report is an outstanding piece of work. And one of my tasks as Minister of Health, with the assistance of our new Associate Deputy Minister of Health, Don Thomas, the former Vice President of the Vancouver Island Health Authority, or the current Vice President, who is working for us as Associate Deputy Minister of Health as well, and an outstanding leader, and Mary Ellen Turpel-Lafont herself, and Indigenous leaders across BC, is to implement that report, because it provides, I think, a clear roadmap with respect to Indigenous people in healthcare in what we need to do. And I think we've started some of this work with a significant engagement in many health authorities. In particular, I would argue, in the Interior Health Authority over time. And I would note the work with many nations in the Interior Health Authority of the former CEO, Chris Mazurkiewicz, who the member will be familiar with, which was excellent work. But it was a collective work. It's why we now have the most diverse health authority boards we've ever seen. And each health authority board has 2 Indigenous members on it, but many others who represent diverse communities. At every level, we have to put this at the center of our action. And one of the things that I'm most proud of was the decision by this legislature to introduce and pass Bill 47, which repealed Bills 29 and 94, which disproportionately and outrageously negatively affected racialized communities in healthcare. And we passed that bill unanimously, one of the most important days that I will never forget in public life. So we have to make those actions in terms of, at every level, from a leadership level to a board level, to a hospital level, to a community level. We need to make the healthcare system a reflection of the anti-racism that we all aspire to represent in the conduct of our daily lives.
Member.
Thank you, Chair. And I would agree with the Minister. Through the Chair to the Minister, so what are the specific funds dedicated to this end? And I'll ask it maybe a little bit of a different way, as he brought up the Turpel-Lafont report, is which of the recommendations of the Mary Ellen Turpel-Lafont report will be implemented?
Minister.
Thank you very much, Honorable Chair. Mask off, glasses on. The task of Don Thomas, who will be leading for us, of the team involving the First Nations Health Authority and First Nations representatives, but also representatives of healthcare that we put in place, is to implement the report. Part of that implementation, and budgeted this year in incremental funding, is $45 million over the next 3 years to deal with First Nations cultural safety and humility. That's not necessarily the sufficient number or the number, but that is additional incremental identifiable dollars that are in place right now to address the issue of addressing Indigenous racism in our healthcare system.
Member.
Thank you, Madam Chair, and I would agree with the Minister. That's a great start. My next question through the Chair to the Minister is how much of the budget is going towards the First Nations Health Authority?
Minister.
Just in the interest of time, because I know the member has more questions, I'll say this, that obviously the primary funder of the First Nations Health Authority, which I think was a really significant achievement of the previous period, because people in BC will know the outstanding work led by Grand Chief Doug Kelly in developing the First Nations Health Authority, and many other people as well. And I know the challenge of that because of the diversity of views that's there. The First Nations Health Authority took its primary funding from the previous services provided by Health Canada. So there's the federal funding, and then there's an agreement we have with the First Nations Health Authority that's significant in terms of funding. And what I want to bring up to date for the member, and I'll share with her in the morning, is the work we've done together in terms of immunization, because I think the First Nations Health Authority has played a really remarkable role working with regional health authorities in that, such that in all of the many diverse 204 communities around BC, all of community approaches and priority was given to immunization against COVID-19 in those health authorities. In addition, there's a series of tripartite agreements. We have agreements with the First Nations Health Authority to build out First Nations-led primary care. For example, in my constituency of Vancouver Kingsway, at 12th and Nanaimo, Luma Housing has a community health clinic. That's one of the development projects of that. In Surrey, there's others. We're building and doing that work in the Eastern Fraser Valley with the Stehalis. So there's a primary care plan to expand out Indigenous-led primary care facilities in BC that will serve Indigenous communities and inevitably the broader community as well, but Indigenous-led, directed by First Nations communities. And the work we're doing with Métis National Council and others. So all of that work is coming together, and we see that we provide both, therefore, operational funding to the ministry and to the First Nations Health Authority, and I'll just read this out for the member. The ministry provided $5.51 million in 2016-17, $7.88 million in 17-18, $10.27 million in 18-19, $13.17 in 19-20, and I will have this written out for the member like the other one, and $10.97 million in 2021 to support joint project primary care initiatives. And I would expect that number will be significantly more in 21-22. In addition, in the period in 1920, the ministry provided a further lump sum of $22 million to support the FNHA. And the ministry in the time of the FNHA has also provided $100 million, but that time is from 2006 to 2019-20. That's what this period reflects. The base operating funding for the First Nations Health Authority is $18.9 million. We also manage on their behalf their schedule for their drug program, prescription drug program, and obviously through the Ministry of Mental Health and Addictions are doing a significant amount of projects around the province, and I'll be happy to share all the details of those.
Member.
Thank you, Madam Chair. And I do appreciate the minister and the update. What I would ask is that when you provide, if the minister could provide me not only with the numbers up to 2020, 2021, but also 21-22, and what is included in this budget. I also want to just echo the commendation of the First Nations Health Authority and just how comprehensive their health and wellness indicators are. I think that there's a lot that we could learn or glean from how they are actually transforming health and wellness and how they are actually emulating just some of the cultural aspects, and it's truly a beautiful document and a beautiful read. So I hope that we support this effort in meaningful ways. There's also, though, the Métis Nation health that we are contemplating or mindful of, as the Métis people make up a roughly 1/3 of BC's Indigenous people, yet the government does not use distinctions-based language or include the Métis Nation in the provincial budget. So in the spirit of reconciliation, and this is the question through the chair to the minister, and in the year your government passed a Declaration on the Rights of Indigenous Peoples Act, could you please tell me why, could the minister please tell me why the government excludes one of the recognized Indigenous groups in Canada's Constitution?
Minister.
Thank you very much, Honorable Chair. And I just say, just to finish on the FNHA, that from the beginning of our, we stood up our response to the public health emergency around COVID-19. The First Nations Health Authority has been represented at every meeting. They've been involved, integrated at every level, as they are at every time the Health Authority chairs are together. The First Nations Health Authority is represented. In other words, I think they've been a key part at every level, including the leadership level from the beginning of the pandemic. With respect to the Métis Nation BC, as was the case under previous ministers of health, we work with Métis Nation BC. Funding is provided, but it's the First Nations Health Authority is a different creation. It's a creation of the federal government, and came through a path in its own way. But I'll just give you an example. The In Plain Sight report that was developed by Dr. Turpin-Lafont, and the process going forward to there will include Métis Nation BC, as you would expect. So we continue to do that. There is, I think, and I think it's fair to say that as Minister of Health, we've continued what previous governments have done in this respect. But I think Métis Nation BC has played a very important role in this, and we'll need them to continue to play a role, because as the minister, the member rightly says, the Métis Nation is a significant fact in BC life, and they're significant health indicators. One of the things that we determined, for example, through the immunization program is a very significant level, and so the Métis in BC were included in the vaccination program. As you know, Indigenous people in BC, 18 and above, who are not living in First Nations communities, were included from the beginning, and there was some debate about that in some places, but included from the beginning. And that included Métis people in BC from the beginning. When we opened it up to our elders, we also included Indigenous people 18 and above. And the impact on that is reflected in the numbers that we have for that, which is that as of, just looking at the date here, because our vaccine numbers change every day. As of last week, 67.7% of Métis who are 18 and over had received their first dose vaccine. So we were able to determine that, and we put that measure in place, and that was put in place on the recommendation of the provincial health officer, who also works with Métis Nation BC as well. And just note as well that amongst Métis people, 84.6% who are 65 and older have received their first dose immunization. So the effect of prioritizing and working with it is that community was well protected in terms of, in terms of vaccination, and very much involved at that level, at that priority level, because of the social determinants of health outcomes that we all know are reflected in general health information around BC as well. The In Plain Sight report obviously reflected on and directly addressed the concerns and involved the Métis Nation BC, and Métis people in British Columbia.
Member. Thank you, Madam Chair. So through the chair to the minister, the Métis Nation Relationship Accord 2, it lists the health of individual families and communities as a shared priority. And I agree that we do see the health status of Métis people in the Mary Ellen Turpin-Lafont In Plain Sight data. And it actually notes that Métis health is actually quite poor. And on page 132, Métis citizens experience significantly higher rates of hypertension, diabetes, depression, ischemic heart disease, COPD, compared to other residents in BC. So through the chair to the minister, will there be an investment made in Métis health this year?
Minister.
Honorable Chair, I think one of the important things to look at is the data and to properly assess needs. And one of the things that the provincial health officer I expect to do this year, who regularly and has recently released wellness reports with respect to First Nations community, Indigenous people, will be expecting to do a similar wellness report, which will help guide, I think, our policies going forward. In addition, we have a partnership table on the implementation, which will involve Métis Nation BC of the In Plain Sight report, and that's a priority. And we continue to expand services, particularly in communities such as Surrey and Vancouver, for Indigenous people, Indigenous communities. So I'm not sure whether you see something in parallel to what we're doing with the First Nations Health Authority, but certainly as demonstrated in the COVID-19 vaccination campaign, in the ongoing work of the Provincial Health Officer and the In Plain Sight report, it shows the priority we give to the health and wellness of Métis people.
Member.
Thank you, Madam Chair. So we'll switch a little bit to a different form of racism, and that type of racism we've seen is the 700% in terms of increase in acts of violence against Asian and South Asian British Columbians. Many Asians found accessing information as well as their vaccinations during this last few months difficult. And racism is not always overt or direct. Oftentimes, racism can simply be what we're providing care or the way that we do so in a way that's not understood or accepted or socially proper in other cultures. My question through the chair to the minister is, what is being done to address this for other racial minorities that fall outside of the Turpel-Lafont report?
Minister.
Thank you very much, Honourable Chair. And really, this reflects a government commitment well beyond the Ministry of Health as directed from the Premier's office. And it's reflected in individual initiatives. For example, the restoration of the BC Human Rights Commission, which empowers people. As an empowered government, it empowers people to see the expression and to support and give expression to the need for human rights across communities in our province. It sees expression, yes, and in the In Plain Sight report. In the work on a day-to-day basis, I think that we carried out in the immunization campaign to provide communications across communities and to respond to communities. One of the reasons we sought out in a broad request for public involvement, the views of hundreds of thousands of people, to hear the specific views of people in different circumstances across the province. So there is significant initiatives across the healthcare system, both in terms of representation at all levels and in terms of anti-racism, to reflect that in the way the health system interacts with all communities, and to give priorities to issues as well. One of the things that we worked on, and I worked on with people in my community, which is maybe the most, or the second most diverse community in all of BC, is the impact of hepatitis on certain communities for historic reasons beyond the communities that happen to be the case. There are certain, and the priority given to that care reflects the work that the community did and advocated for people in the community. So we have to empower community members. We have to see they have to be reflected in the boards of healthcare and the senior management of healthcare. I'm very proud, for example, in terms of the representation of women in our healthcare system, which is important, that all 5 regional health authority presidents are women and are leading efforts to reduce racism in their health authorities. I think that reflects the change we'd like to see. So all of those actions are taken, but we have a government-wide responsibility in everything we do to reflect anti-racism in our government, and all of those actions taken, from high-profile actions like the restoration of the BC Human Rights Commission, to the day-to-day actions, to our response to racism when it occurs. I think that's the responsibility of every minister in the government, and since the Minister of Health, of course, represents a significant share of both the government's budget and those working for government, and an organization such as Fraser Health is in maybe the most diverse health authority in the country, led by Dr. Victoria Lee, is leading many of those efforts in their jurisdiction. I think the health system is working on these issues. I hesitate to say that we're doing a good job, because that would imply that I see an end to the need for this work, or that there's something that we've achieved that is sufficient in the face of the problem. But I think it's something that I expect at every level our healthcare system to reflect all the time. And some of the key actions we've taken have certainly reflected that.
Member.
Thank you, Chair. So I'm glad that you brought up the issue of women. And I want to talk a little bit about something that many women would find somewhat discriminatory. And that is the issue of birth control. So me, having 4 boys and a girl, have many talks about the cost of being a woman, but also the cost of not being able to afford birth control. In this last election, as well as the election before, the NDP promised, as part of its campaign, to fund birth control for women. So through the chair, to the minister, will the minister commit to funding all types of contraception, as a one-size-fits-all is not appropriate in this matter?
Minister.
Honourable Chair, the Premier, our caucus committed to a program in the election campaign, and we are working and consulting with people to implement that program, and we will, as a government. And we're doing that work now, and it's a significant campaign commitment. I'm happy that that the opposition parties, including, I think, the Green Party, are supportive of that. That's good news. And it's our intention to move forward, obviously doing the work on it now, as we have in a number of other areas where we've expanded access and led the country in access, particularly with respect to women's health, and have done so, I think, in a thoughtful way that empowers people. An example of that was when I first became Minister of Health, and we became the first province, and it required significant ingenuity at the time in the creation by the Provincial Health Services Authority and the Pharmacare Division of the Ministry of Health to provide first dollar coverage for Mifepristone, and that has transformed a woman's right to choose in the province without a massive public debate, and sometimes these issues are difficult, but we expanded the rights of women and choice in our province in a significant way. And the result is, and the result I think would be interesting to people, is the access for women across the province in a more equitable way, not just in major centers that had what were subjects often of huge debate, such as abortion clinics, enhance their access to and their control. And the result has been, as I think you would expect, a significant reduction in the number of surgical abortions in our province. And all of that happened because we took action in that area on a major women's health issue. This is another major women's health issue. The Premier has stated the position of the government. It's my job to implement a program that works for women, and we're doing the work right now, led by, in the Ministry of Health, by our pharmacare division, but obviously involving women as well, to see that this program is implemented. And it's a fundamental commitment, and it's my expectation that it will come forward consistent with the commitment made by the Premier in the election campaign.
Member.
Thank you so much, Chair. Through the Chair to the Minister, when will this funding be available to women?
Minister.
The officials of the Ministry of Health and others are consulting widely now and putting the program together, and when we're ready to announce it, and we'll develop, of course, the funding in support of it, we'll announce it to everybody. So I don't have a date to provide to the member, except to say that it's a commitment by the government in this mandate, and one that we absolutely intend to deliver on.
Member.
Thank you so much, Chair. Through the Chair to the Minister, is it in this budget?
Minister.
Honourable Chair, the pharmacare budget is a broad budget. We make allocation decisions within it, but the program will be ready when it's ready, and then it will be announced by the government and implemented. And so I'm not announcing it today, so I'm not providing a date today, but I can tell the member that the government intends to deliver on this and is doing the work to see that that happens.
Member.
Thank you, Chair. As part of also looking at women's health, would the minister commit to funding a portion of fertility treatments as well?
Minister.
Thank you. That's not something that we've considered in the current fiscal year. It's, I know that there's significant advocacy for people who wish to access such services and would like the government either to support it or to provide support for it. So I hear that advocacy. I meet with groups from time to time in that area, but there's not a plan in this fiscal year to pursue that, different from the previous proposal where there's a specific commitment. We're doing active work.
Member.
Thank you, Chair. So in other jurisdictions, there are supports for women with fertility treatments that are provided by provinces. And I would ask, if it is not in this fiscal budget, through the Chair to the Minister, would the Minister consider providing some planning exercises to potentially include it in further budgets?
Minister.
Thank you, Honourable Chair. That's an issue we'll continue to work on and obviously hear from people on. I think, as I recall, the advocacy on this issue has taken place now over decades, so there's regular requests for people to ask us to consider this, and always always requests to expand the scope of healthcare, and so we'll absolutely consider that in future years.
Member.
Thank you, Chair. So because we have only really one more question time, I believe, I'm going to go back to the BCEHS for just one more, because I had a question that I omitted. And that is that paramedics stationed in rural communities were previously guaranteed 4 hours of pay per on-call shift at a regular pay rate, whether or not any calls came in. That model, the kilo guarantee, was phased out, and the 2-hour or $2 per hour model became the new normal. This was with the understanding that the BCEHS would resume work on a new scheduled on-call model. And is that the model that was brought in just recently? And why was this change done in the middle of a pandemic before we had work on a new scheduled on-call model was completed?
Minister.
So the reason, Honorable Chair, and with this, at the end of this response, I'll move the motion. If I think that's we're at that time. I get that. I get that sense. The reason we're proceeding is to improve the ambulance service. And the scheduled on-call model was part of our negotiated collective agreement. It involves the hiring of hundreds of full-time paramedics all over BC. It is the plan we need for the future. It's consistent with the direction of the ambulance service, and it's the right, I think, approach for people for the ambulance service in BC, and it reflects our signed and negotiated agreement. So the member is suggesting that we not make these improvements because we're in a pandemic, I think. I don't think she really is suggesting that, so I want to be fair, but and I don't think that's the case. I think we have to continue to take steps to improve the ambulance service. That is precisely what we're doing with the most significant investment we've ever seen, most significant hiring of people we've ever seen, the transformation of the ambulance service, the essentially professionalization, the creation of full-time paramedics where they did not exist before. This is an excellent plan and one that we have to continue to proceed with. And I suppose we could have put the plan on hold. I suppose we could have asked the union to put the collective agreement on hold, but we believed with what we negotiated was the right thing to do, and that's why we're proceeding.
Member.
Thank you, Chair. So I'm going to read out just a response back from the member from, I'll have to look up which one she is. Caribou North? Yes, Corley. Yes. Okay, so Caribou North, sorry, thank you. I'm like thinking north-south. Yeah, there's so many. She actually says that she wants clarification on this, and she thanks you for the response. But just to clarify, 2 ambulances are currently serving Quesnel until the end of June, 1 full-time, 24/7 with 8 full-time positions, 1 on-call, 24/7, currently 6 on-call staff at the Quesnel station. Previously, 1 ambulance was staffed with 1 full-time paramedic, 1 on-call paramedic, with both crew members posted in station for their shift. You are correct that a change occurred to the on-call paramedic position to a full-time FTE in April 2021, which resulted in 4 new full-time FTE in Quesnel. You've been advised that there is no change to the second unit in Quesnel, and you've been provided possibly a misleading statement, which is very concerning. The critical information not raised to you is that the 4 new full-time positions went to 4 local on-call staff, which has subsequently resulted in the on-call unit going out of service. The station only has 4 on-call staff left. Likely this unit will be completely unstaffed by August 1st, leaving 1 ambulance servicing a large area. The community ambulance responds to approximately the community ambulance is 4,000 calls annually, 2,700 calls completed by the full-time, and 1,300 calls completed by the on-call. Without the second ambulance staff, there is no one to respond to 1,300 calls. This will lead to negative patient outcomes. The closest ambulance for support is 130 kilometers away from Prince George, 130 kilometers from Williams Lake, or 100 kilometers from Wells, if in service. These communities are also struggling to staff ambulances and often do not have units available. To give you an understanding of the size of response of area for the Quesnel station, the ambulance responds 70 kilometers to the south, to Alexandria, 70 kilometers to the north, to Hickson, 130 kilometers east to Wells Bowron Lake, and 200 kilometers west to Kluskis, including serving a large Indigenous population. So I don't need a response necessarily for that. I understand that's a lot of information for the minister to take in, but I just wanted the minister to be aware of that in response to what the minister had said at the beginning of ours. But with that, I will conclude for today and come back tomorrow with regular vigor.
Thank you, Member. Minister.
I just note that the transformation of 4 on-call positions to 4 full-time positions is good news for people in Quesnel and good news for those 4 people. Right? It is. But I'm happy. I have very positive working relationship with the member for Caribou North, so I'm sure we can have a further discussion of that, Honourable Speaker. And with that, I would say that members of my caucus often understand my desire to go into overtime. I feel that the elimination of the all-night session is really not, is something that is may not have been a good innovation. I'm always ready to go all night. I'd love it. But with that, I'll be all alone in here, but that's all right. Honourable Chair, I move that the committee rise and report progress and ask leave to sit again.
Thank you, Minister. Members, a vote is about to take place, and those participating remotely should prepare their voting cards. Members, the question is that the committee rise, report progress, and seek leave to sit again. Those in favour, please indicate aye.
Aye.
Those opposed, please indicate nay. The motion is carried. Thank you, members. The committee now stands adjourned.